Contrary to what many people thought at the beginning of the pandemic, this virus was not a great equalizer. Many women were left behind.
In the last 2 years, women's participation in the United States labor force has decreased to levels we haven't seen since the early 1990s. We have lost more than 2 decades of progress.
For women of color, the economic toll of the pandemic has been especially profound. It has exacerbated existing disparities in ways that are frankly startling.
We tell young women that they can have a career and a family and achieve some level of work-life balance. But are we really telling them the truth? The pandemic showed us that for a lot of women, it's an empty promise. We need to change that.
As the pandemic continues, you start to wonder, is this what life is going to be like? Are we going to have to juggle our mommy life, our personal life, and our business life? Is this what the future holds? I think with childcare, it disproportionately impacts women when it's not accessible, and it causes women to leave the workforce or to work less than they want to. I'm looking for that human understanding, that empathetic core that understands we're all people and we all have lives. I want to know, how do you value me as a human, not just as an employee?
The goal of this summit is to bring together thought leaders, policymakers, and practitioners to share knowledge on the topic of the economic future of women in the United States and around the globe. Spelman College and the Global Institute for Women's Leadership at King's College are dream partners when it comes to covering all perspectives and aspects of the issues related to women's equality.
I hope that this summit inspires people who are in a position to make change and make a difference to do so from wherever they sit. You know, I know that some young women look to the future right now and really wonder what it's going to be like. I hope that as a result of efforts like this, today's young women can actually experience a future of spiritual and material prosperity, a future of well-being, comfort, ease, and the realization of their dreams. That's really what I hope we achieve.
Welcome to the first session of the second day of the Economy She Deserves Summit. On behalf of the summit organizers, I want to thank you for joining us. My name is Courtney Coyle. I'm a professor of economics at Wellesley College, and I'll be the moderator for this session. One quick housekeeping announcement before we get started. For live sessions such as this one, you can use the chat feature to enter questions or comments. We'll have some time at the end of our conversation where we can pose those questions to the panel, who I'll introduce in just a moment. The subject for this panel is exploring the new paradigm for work and family. As we all know, women's lives are multifaceted and complex. More than 4 in 5 US women between the ages of 25 and 54 are in the labor force. The vast majority of these women are partners, parents, or caregivers who are juggling the responsibilities of work and family on a daily basis. The omnipresent challenges facing women have only been exacerbated by the COVID-19 pandemic, making this an opportune time for us to be discussing these issues. In our session, we hope to shed some light on how women's expectations and needs in the workplace are changing and how employers and public policies can better support them. We aim to focus not only on high-income professional women, but also more marginalized workers, and to explore these issues not only for the United States, but also low and middle-income countries. That's a very tall order, but we have a wonderful panel to help us do this. So let me introduce them now briefly, and you can find longer bios on the website for the conference. Lucy Melvin is a principal in Deloitte Consulting's government practice in Deloitte Consulting's government practice, advising government leaders on people-focused strategy. She focuses on helping government clients embrace the future of work, including strategies to increase workplace flexibility and workforce inclusion. And she's also a proud mom of 2 future feminists. Philip Levine is the Catherine Coleman and A. Barton Hepburn Professor of Economics at Wellesley College. Phil's research explores a wide variety of social issues, including fertility, policies to improve the well-being of disadvantaged youth, and access to higher education, which is the subject of his most recent book. Rakeen Mabood is Chief Economist and Managing Director of Policy and Research at the Groundwork Collaborative. Rakeen is an expert on economic inequality and the 21st century workplace, with particular emphasis on how structural factors such as racism and sexism perpetuate inequalities. And Aishwarya Lakshmi Ratan is Deputy Director of the Economic Growth Center, which is Yale University's hub for research and teaching on international development and trade. Aishwarya previously worked on the Women's Economic Empowerment Strategy for the Bill and Melinda Gates Foundation. Lucy, let's get this conversation started with you. I know that you were recently involved in conducting a large survey of women who work full-time in large organizations, spanning a wide range of titles from executive assistant to vice president. What does this data that you've recently collected tell us about the challenges that women face in the workplace in general, and how these challenges may have been exacerbated by the pandemic?
Thanks, Courtney. So to be honest, for those of you who are working women or who have been talking to working women during the pandemic, I think our survey findings don't tell us anything all that surprising. It's what we've been hearing throughout. But what they do is they illuminate the magnitude of the impact of the pandemic and the persistent barriers that working women face, and challenges that organizations and leaders are solving for right now as they try to retain talent in this environment. So here are a few examples. Women who are caregivers are feeling more pressure to juggle childcare and elder care demands. Meanwhile, non-caregivers reported that they're facing pressure in their jobs to always be available. And the bottom line is that all women in the workforce are feeling overwhelmed and like they're always on. So for employers thinking about retention and employee development and succession, the really key insight here is about the concerns that 3 in 5 women reported who are questioning what they think it takes to move up in their current careers or organizations. And the top things that women who are questioning moving up in their organizations, they cited, a lack of work-life balance, non-inclusive behaviors like daily microaggressions, and a lack of flexible working arrangements as the challenges that they're facing.
Thank you. You've given us a really good description of some of the challenges that women are facing. So let's think a little bit about what employers can do to mitigate some of these challenges. What can employers do to help women and all of their workers more successfully juggle the multiple roles that you talked about, feel like they can advance, and feel like they're in a workplace safe from those microaggressions that you mentioned?
Yeah, I think our findings show that organizations need to first really establish work flexibility as the new normal. So embracing hybrid as the future of work. They also have to focus on creating inclusive work environments. So addressing those non-inclusive behaviors that are creating challenges for women in terms of their development and advancement. And then finally, offering career development and benefits that women can tailor to their needs and their goals. We have to stop assuming that all women are looking for the same things and recognize that it's about providing the benefits options and the career development pathways and opportunities that are tailored to their needs.
Rakeen, I want to turn to you next just to broaden this conversation a little bit. I think that the kind of workers that Lucy was just talking about are often working in environments where it's in a salaried position, a so-called 9-to-5 job, although we know jobs are rarely 9-to-5. They often spill over and into all kinds of other hours. But of course, we want to think about other kinds of workers, people who may be working and being paid hourly, maybe not have a regular schedule that they can count on. Tell us a little bit more about the challenges facing those women right now, whether they look similar to the challenges Lucy was just telling us about, or what unique challenges might be facing them, especially here as we're still kind of in the wake of the pandemic.
Thanks, Courtney. And it's such an important question, right? I mean, I think it's first important to just note that people in precarious, low-paid jobs are much more likely, disproportionately likely to be Black or brown, disproportionately likely to be, have a disability or be a part of another historically marginalized group. And that's important to note because until the most marginalized among us in the labor market are doing well, our labor market is fundamentally broken. And because, as we say at Groundwork, we are the economy, right? Until the economy and our labor market works for us, it's not working for anyone. And so, many of the challenges that Lucy highlighted are similar, right? If the pandemic has showed us anything, it's that all of us are people. We're not just workers, we're not just caregivers. People live multifaceted lives, and we need a system that really wraps around and addresses all of those issues. So just as, we need, career trajectories and paid leave and, adequate care infrastructure, which are fundamental parts of a healthy labor market that works for everyone, equally important is safety on the job, is dignity on the job, is access to power on the job, which means union. And shout out to the Amazon workers who unionized yesterday with a huge victory, right? Protection from wage theft, protection from unpredictable schedules. And I think it's just important to recognize that many of the privileges many of us, myself included, take for granted, a stable job with a predictable income, with benefits, with predictable work hours, that's not accessible for a vast majority of people who are working multiple jobs trying to make ends meet. And so we really need to think about the system as a whole and how we make that system work for people's lives.
So I actually want to pick up on what you were just saying about the system as a whole. Lucy was talking to us a minute ago about the things that employers can do, and obviously that's going to be an important part of the solution. But I know that in your work, which really thinks about trying to create an economy that is more people-centered, that employers may not sort of alone be able to make all the kinds of changes that we need. So, what's your perspective on kind of how we get there, the role of the employer versus the kind of larger societal or policy kinds of changes and supports that might also be needed?
Yeah, I mean, I think looking at the future requires us to look at the past, right? Because fundamentally, we didn't get here by accident. Our broken labor market, especially that broken labor market for women, is the result of decades of policy choices that we've repeated over and over that have entrenched inequities, right? Our labor market, to be totally blunt, is built on a rotten foundation in the US, right? It's built on the forced labor of people, of Black people, when you go back to slavery. And so when you reinforce that foundation over and over again through policy choices such as exclusions from the New Deal that, really excluded domestic workers, agricultural workers from access to unions, access to protection on the job, and you copy and paste that over and over again, you fundamentally kind of recreate the same sort of faulty system that we're seeing today and we've always seen. So all of that is to say that these are societal problems and they'll require societal solutions. So moving forward in a piecemeal way, failing to center the most marginalized workers in our economy, turning this over to employers or to states who, historically have not always done the best by workers, especially those who are precarious in the labor market, will only deepen the racial and gender inequities that already exist. Our labor market has been broken for a really, really long time, and tweaking around the edges has never really been a viable option. But the pandemic has made crystal clear that we really need to take a holistic, big picture view of how to create a labor market that really, truly works for women.
So we will circle back and return to this issue of U.S. women workers, but I don't want to get too much further into the conversation without kind of broadening our scope, and because we do intend to make this have a global perspective here in this session. So that means I'm going to turn to you, Aishwarya, bringing you into this conversation. Tell us a little bit about, first of all, the challenges that women are facing when women in low and middle income countries. I think some of us may not even be completely up to date on what are the roles that women are playing in these economies right now, and what are the challenges that they face. Are they similar to the kind of challenges we've just been hearing about, or does their situation look somewhat different?
Indeed, and I think it's very useful to have that global perspective, because there's a lot that is common. It certainly takes different forms, and there's a lot of learning that can happen across institutional designs in different countries over time. So I think let me start by describing, like you said, providing a little bit of context, and then talking about the challenges. So in terms of where women are in the economy in low and middle income countries, let's take two examples. India. It's now a lower middle income country. You've seen strong growth rates, for the decade after the financial crisis, around 6%. But you've seen this alongside a fall in labor force participation rates for men and for women. So about a 12 percentage point drop, over the same period of time, which is curious. But at the same time, while men's sort of participation has gone from like 82 to 70%, women's participation started at a low of 32% and fell to 20%. So right now, only 1 in 5 women of working age in India participate in the workforce. And this is alongside, like I said, rising household income and dramatically falling fertility, which Phil will talk about as well. So that is an interesting predicament. Why are women not participating when there seem to be channels to do so? Then on the other hand, let's look at a context like Ethiopia. Low income country, very strong growth, over the past decade or so, until again COVID hit, about 10% or so. You have again a slight, fall in labor force participation, but not as much, 83 to 81%. And so men have been at 84%, but women have been fairly stable at 74%. Again until COVID. And in both these countries, the point I want to emphasize is the vast majority of working women are informal workers. So this means that about 90% of working women do not have the kinds of protections that a lot of secure employment takes for granted, and it's often in services and agriculture. And so, with that sort of context, thinking about the challenges in India, for example, an obvious point that falls out is you need to think about the challenge of getting women into the workforce, the very basic sort of participation barrier, right? And so investigating why is it that women exit the workforce, and there's often, a dynamic around the point of marriage, is really important. So is this because of a lack of appropriate jobs for women in this kind of normative environment? Is it just the norms themselves that are constraining women? Is it the, internalization of norms? Those kinds of questions. On the other hand, if you look at East Africa, for example, women are in the workforce. So then how do you improve sort of the returns to their work? How do you remove the risks and the costs associated with their work? And here there are some interesting parallels. There's like a landmark study from Denmark, for example, about the motherhood penalty, right? So you see this 20% when the child arrives. For the mother, a 20% drop, in her earnings, which persists across the course of her life, not so for the father. So in Uganda, for example, in East Africa, it would look quite different. You see a very persistent, given that it's the informal workers at large, you see in this wonderful study, a 60% gap in the sort of profit between, men and women owners of very small pharmacies. And there's a really neat study trying to understand what is driving that. And in this context, the researchers find that 38% of women bring their young children to work. And this is the strongest driver of this is that this doesn't allow them to restock their goods in order to sell more pills. So 45% of the profit gap is explained by the presence of the child. So I think those are the kinds of ways in which things look quite different in developing economies.
Wow, you've given us a lot to unpack there, and I'm tempted to ask, 10 follow-up questions, but I'll try to just limit myself to maybe one here, because we do want to also bring Phil in to talk about fertility, as you mentioned. You mentioned how women are often in the informal sector in some of these, maybe I'll do a two-parter question. You mentioned women are often in the informal sector, so I guess I would be curious whether even relative to, say, men in the informal sector, whether they are sort of at any disadvantage because of their gender, or is it really just that workers in the informal sector, don't kind of have the benefits of workers in the formal sector? I guess that would be part one. And, part two, what can we do to make it more of a choice for women to stay in the labor market at the point that they get married or have children, if that's indeed something that they'd like to do?
Indeed. And so I think the first point of clarification I'll make is that I'll point to sort of the ILO definitions, because the informal sector certainly is one issue. It's very large, but the informal workforce is in fact larger, which means that formal employers and global value chains do employ informal labor. So this presents a very interesting opportunity for intervention, because there are certainly, these providers can certainly provide some of the protections that you would anticipate providing in the formal sector. So that's just one clarification. And you're absolutely right that it is precarious for men and women in informal work, but there are very specific, and this goes into the whole domain of intersectional disadvantage and vulnerability. So an informal street vendor who's a woman versus a man, or an informal domestic worker, faces very different constraints, compounded constraints, and this shows up also in the differential wage rate, in the differential returns, in the market itself. Like I said, a 60% gap is a massive difference for the same kind of service provided in the market. So in terms of what can we do about it, I'd say it's nice to think about different timeframes. So in the short term, I think the emphasis has to be on a very robust social protection system. So similar to what Rakeen was mentioning for the US, and COVID has again made this very clear. So in a country like India, you have very large government programs. It's a welfare state, large government programs, food distribution, workfare, very large programs, and integrated child development service, for children under 6, which is amazing for a country at India's income level. But at the same time, these are not growing investments. The government is very heavily sort of looking at optimizing and cutting back, which is not the case. You really need to amplify these investments. And for two reasons. I think it's not just for social protection. These have ramifications for workforce and productivity. That's the link between security and productivity. So there's some very good work by affiliates at the EGC. So there's one set of work, for example, on directing payments, workfare payments to women's individual bank accounts versus to the household account, where you see a dramatic, an actual shift in increasing labor supply because I'm able to control my finances a bit better. So that is good. That's social protection working in favor of economic participation and productivity. And also, I think another domain I'd highlight is early childhood development. This is, again, not just for women's workforce participation, but also extremely important. Like 9 in 10 children in low-income countries by the age of 10 cannot read with comprehension in their local language. We're not going to get anywhere with that, So without very strong cognitive development, social economic skills early on, it's very difficult to sort of bridge intergenerational gaps. And just very quickly, I'd say medium term, you've got to think a little bit about growth policy and your options. Do you want to have, and what is gender intentional about it? Do you want women to specialize in certain industries, a little more path dependent? So 70% of the global workforce, care workforce, is women. So a little bit of this path dependency, yes, women go into sort of, hospitality, healthcare, education. Or do you want to try diversifying women across all parts of the economy, which would be a little more like, let's institute things like quotas, affirmative action, distribute women, across sectors, which requires intentional public policy. And in the long term, I think the piece to keep in mind is the normative environment, which looks, again, very different in a context like South Asia or Sub-Saharan Africa. But here the goal is to intervene early. And there's some very promising programs on sort of building, especially for young men and boys, some of this critical consciousness of gender and how it can translate into both improved attitudes over lifetime, but also then behaviors, which men have more freedom to change than women in these environments.
Thank you for that. And I do want to turn to Phil now and take us to talking about fertility more specifically. There's been a sort of thread running through a bunch of the comments, talking about women balancing work and family, how childcare supports might be part of the system that's necessary. Are women still able to work after they have children in developing country contexts? But, we don't want to presume that we don't want to necessarily, as an economist would say, sort of to treat that fertility decision as exogenous, take it for granted. It is actually a decision that the woman's making thinking, and we've seen a lot of changes over time in both developed and developing countries about fertility decisions. But let's stick with the sort of pandemic piece of this first. So Phil, I know you've been looking at how women's fertility decisions have been impacted by the pandemic specifically. What can you tell us about that?
Yeah, well, I've been working on fertility issues for a long time. A lot of the work that I've done is with a co-author, Melissa Carney, who's at the University of Maryland. And when the pandemic first hit, we started getting phone calls from reporters asking us what we thought about the coming baby boom. And we thought that was an unusual question. And when we pursued why, what was leading to that question, they would say, well, it's just like a blizzard. And, people are bored. You can only go so far with Netflix. And before you know it, we're going to see an increase in births. That is actually not how we were thinking about the problem. We were sort of thinking that what we would be expecting was a significant decline in fertility. So, we decided to put, pen to paper and think about what would we actually forecast for a decline in birth rates. We got a really big number. And, the reason is we based our assumptions on our analysis on the impact of the Great Recession from 15 years ago, because the pandemic generated a huge recession at the beginning. And along with the recession, we also had a public health crisis. And so thankfully, those don't happen very often, but going back 100 years was the last public health crisis. And we have evidence from that on the impact on fertility. Both led to significant declines in fertility. So, crunching some numbers, we came up with, what seemed like very large estimates of what would be a coming baby bust, a few 100,000 up to maybe even 500,000 fewer births. We've had, 2 years of experience since the pandemic began to sort of go back and look at how we did. It turns out that at the beginning of the pandemic, that's exactly what happened. Births started falling rather dramatically over the first few months. Something like 60,000 fewer births occurred, or children were conceived after the start of the pandemic. It turns out, though, that ended very quickly and actually rebounded later in terms of conceptions later in the year. So by the time you got to the end of the year, the 60,000 deficit in births, rebounded to maybe a 10,000 deficit in births. There was a 50,000 birth rebound, and which is not what we were expecting. And then, it's important to think about what did we get wrong, quote unquote? And it's not so much that we got it wrong, but, as a country, we spent trillions of dollars trying to undo the damage associated with the pandemic. And it turns out the reason why unemployment and recessions reduce fertility is people's pocketbooks are harmed and you don't have the money. And if you replace the money, you replace the birth deficit. So in the end, it seems like, it wasn't that much of an impact, despite the fact that at the beginning of the pandemic, exactly the sorts of things that we were predicting did occur.
That's fascinating. And as you said, I don't think you got it wrong. It's the world turned out different than anyone could have expected at the beginning of the pandemic. In addition, not only because of the support, but also that really large drop in jobs started to come back, I think, also faster than maybe people initially had predicted. Help us put this a little bit more in long-term context. What has been happening with sort of overall trends in women's fertility, and how is that sort of tied up with what's going on in the labor market? How is women's progress in the labor market, or lack of progress in the labor market, then impacting fertility decisions?
Sure. I mean, the interesting thing about, questions about COVID and fertility is that it's such a short run, regardless of what was going to happen with COVID, in the grand scheme of things, it was going to be a short run effect regarding fertility. So putting it into this broader perspective is the longer term trend in fertility is much more dramatic than what we could have expected coming out of COVID. So going back, after, from the 1980s into the early 2000s, basically birth rates were stable in the United States. And then we got to the Great Recession in 2007. From 2007 till now, births have fallen about 20%. And, at the beginning of the period, the fact that the recession caused some of it, that's fine and not all that surprising, but it hasn't stopped. Right? It's been going on ever since then. So, we have this continuous decline in birth rates. 20% is a lot. So the question is why? Like, what's leading to this, systematic trend towards lower fertility? So we tried to investigate. One of the things that, as a statistician, one of the great things about living in the United States is that we have these 50 experiments that go on simultaneously all the time with our 50 state, with data from 50 states. So we can do things like, let's compare patterns across the states, what's happening in the different states, and the underlying social forces. How is that translating into changes in birth rates? So we rely on a lot of that sort of analysis, and we examine, a handful of completely plausible explanations for what could be explaining the decline. And so we looked at better contraceptive technology. LARCs are much more available than they were, 20 years ago. Childcare expenses have been rising. Housing costs have been rising. The student debt crisis is an issue. Women's labor market opportunities aren't, rising super rapidly, but they have been improving slowly. And sometimes people talk about changing religious preferences and the reduction in religiosity as potential factors that could explain the decrease in fertility. It turns out that in the end, none of those factors really seem like they're correlated with changes in birth rates across states. States in which, for instance, childcare costs are rising the most are not the states in which birth rates are falling the most. That's just not what you see in the data. Which leads to something of a conundrum. So what is happening? And that's an answer which we don't really have a definitive solution to, a problem we don't have a definitive solution to. But what's left is sort of a residual explanation, is that, there's changes in cohorts over time, that, preferences are changing, nature towards lifestyle changes, nature of parenting, what people are expecting out of their lives, life aspirations. We offer that really as sort of, like I said, as a residual. That's still plausible. That's extremely difficult to prove that that's what's happening. But that's that's what we have is remaining on the table. We don't really have any other good explanations for what's happening. The other thing that's interesting about it is there's really nothing in the data that sort of suggests that this is going to reverse anytime soon. This looks like an ongoing long-term decline in fertility that's had us, at a level considerably below replacement for now quite some time, and into the foreseeable future.
So your conclusion that a lot of what we're finding, may be due to things like changing preferences, things that are, harder to quantify and capture, makes me think that maybe a useful way to spend our last few minutes together as a panel would be to bring all of you guys back into the conversation to think about some of the findings of the Lake Research Partners study that was conducted in preparation for the summit, which does tell us something about where young women, in particular ages 18 to 30, what's on their mind and what's important to them. So maybe I'll sort of do another round around the group and kind of ask a question related to that. Lucy, one of the findings that came out of that study was that young women, as they're thinking about what they want from their current or their prospective future employers, that good wages, good benefits, and respect from the employer are kind of top of mind right now. I was just curious, either in your personal work at Deloitte, in the companies that you all work with, do you see the priorities shifting of the kind of newest group of employees relative to women that are a little bit ahead of them in the workforce? And do you see employers responding to shifting priorities?
It's a great question, Courtney. And I think overall we do see a shift. And part of that is the interest in, balance and wellness. And so how young women entering the workforce are defining good wages and benefits is changing, what the expectations are in terms of, different benefits that will help improve wellness. But I also think an important point there is the respect in the workplace. And as we're seeing cultural shifts happen, how young women who are entering the workforce are defining inclusive work environments is different. And I think this is, something that we see a lot of organizations, ourselves included, focused on addressing. And it really is about shifting those cultural norms in our workplaces and creating more inclusive spaces, and addressing, historical structural inequities that have created barriers for women.
Rakeen, let me invite you to kind of comment on the same topic area from the perspective of, I know, again, some of the kinds of workers that you think about are in more marginalized positions, but have similar concerns about wanting respect on the job, and also let me throw in mental well-being as something that came out, mental health, right, is something that came out very strongly in the study. What are as a really important priority for young women? And honestly, we see that in our students too, a lot more awareness of mental health issues and people just, wanting those issues to be taken seriously and wanting to have access to services to help them do that. So what do you see as you look out in the workforce, including women working in kind of more marginalized positions, about whether their needs for good wages, benefits, respect on the job, and support for their mental health is being met by their workplaces?
Yeah, absolutely. I mean, look, the pandemic in some ways like flipped over the rock so we could see all the ugliness underneath our labor market, right? I mean, it really exposed all of the places where we were most fragile. We saw that with sort of how essential workers were celebrated and then sort of forgotten and left behind. And I think that the key here is these problems are long running, right? The pandemic was a catalyst. It sped up sort of our awareness. It sped up many of the trajectories that we've been seeing, but it wasn't the cause of the problems. The cause of the problems are these deeply rooted policy choices that we've been making over the course of the last 100 years, right? 150 years. And so respect on the job, good pay, safety on the job, mental well-being, it's all absolutely necessary. It's become more necessary as we've gone through this incredible economic and health shock. And these are not new problems. I think that's the real core of it. And something that's really struck me in this incredibly wide-ranging conversation is this idea of choice. And when is it that people actually have choice, and when is it that their choices are so structured by the sort of decisions and policies that we've put together as a society that they're sort of pushed into a certain set of decisions, right? Like the beginning of the recession, there's a lot of conversation about how so many women were dropping out of the labor market as though that was their agency, right? Like they were choosing to drop out of the labor market. But to be clear, I mean, people were put in a bind. And we've heard that sort of in all these contexts, right? We've heard it in the sort of, the folks that Lucy works with. We've heard it in developing country context. We've heard it in the context of fertility. It's that people in this labor market and the global labor market we're talking about, women don't feel like they have real agency and choice. And so the real question for me is, how do we build a labor market that allows people to make the choices that are right for them, whether that's for their caregiving responsibilities, their participation in the labor force, or otherwise. And I think that's true regardless of where you sit in in the precarity of your job and your labor.
Phil, there was a question that came into the chat that really that's about fertility, but it also touches on these findings of this research study. And the question had to do with how people's concerns about climate change might be affecting their fertility choices. It did come out in the study that that this generation of women 18 to 30 is just, it ranks near the top of their list of worries is climate change. I don't know if that's something you've done any research on or even just read maybe some things that other people, but how do people's kind of actually existential, concerns like that enter into some of their, and thoughts about personal responsibility as well? I think that's part of it as well. How does that enter into fertility decisions as far as you're aware?
So, I mean, I think that would fall into the category of, shifting priorities. Like, there's underlying, women's underlying beliefs about what they want out of life and the nature of parenting and what they're looking for. Like, as all of those things change, those are all, conceptually relevant, but like statistically extremely difficult to capture. And the other thing which I think is relevant in this is not just the United States problem. And this is something like, what's interesting is actually like in the we're just catching up to the rest of the developed world. Everybody, all the rest of the developed countries have had declining fertility for 30 or 40 years. We are late to the game. So, if it's climate factors or concerns about climate issues or whatever, to the extent whatever is going on, it's global. It is not specific to the United States, which again makes it a lot more difficult problem to solve, because it's a lot easier to have a specific policy lever to pull. It's like, oh, if we just subsidize childcare, that's going to fix the problem. It seems like it's a lot more difficult problem than that. A lot of the sorts of policies that we talk about that try to improve women's outcomes in the labor market, those might be great policies in terms of improving labor market outcomes. But it doesn't take away from any of those things. It's just their potential to impact fertility might be a lot more restricted.
And you mentioned the global aspect, so I'm just going to throw literally in our last minute, just throw one more question towards Aishwarya. So obviously the study that I was drawing everybody's attention to was conducted in the context of the US, and you may not have equivalent, data at hand for the kind of low and middle income countries you study. But did the values that came out of this study resonate with what you know about younger women around the world? That is, a high degree of focus right now on financial security. And also, it was a little bit to differing amounts in different groups, but values like economic opportunity, the ability, entrepreneurship opportunity, being in a strong community, work-life balance, and managing caregiving. These were all things that were on the mind of young women here. Do you see these things also being on the mind of young women around the world?
Certainly there are parallels. So I think two aspects to consider. I think the economic insecurity part of it, the financial insecurity, is a major concern. And I think that goes alongside the shock to young women's aspirations, because this is a very mobile and large group. India, it's like 320 million women, the whole size of the United States, less than 25, and women. So you've got to think about the consequences of this loss in terms of shifts in aspirations. But two quick examples. In Ethiopia, there's a very good study out of one of their biggest industrial parks, because they've really been trying to push ready-made garment manufacturing, a little bit like Bangladesh. But the young women who were laid off, because global supply chains, you remember the whole kind of collapse in Western demand played out by downsizing in these firms. And so all of the women, majority women employed, fell back on absolutely no other labor market opportunities. And so you have this very high food insecurity for those who remained in urban areas, and very, very high sort of levels of stress and sort of related depression. And then in the context of Kenya, there's another good study that looks at the economic aspects alongside the health aspects, which is really important. So when there is this kind of economic shock, you might also see an increase in risky behaviors to just economically get by. So things like transactional partnerships, etc., you see some movement in the wrong direction because it's more vulnerable. There's more, risk. So I think it's much more precarious in those contexts, and the consequences are pretty heavy.
Well, I feel like we could investigate these issues for many more minutes, but we've come to the end of our time. So at this point, I'm just going to thank the panel so much for their time today, and also for their research and leadership on these important issues. So thank you all again for joining us.
Hello, I'm Alina Selyanikoff, Senior Vice President and Director of Women's Health Policy at KFF, the Kaiser Family Foundation. It's wonderful to welcome you today to our panel on reimagining well-being in the wake of COVID-19. We have a stellar panel to help us explore this issue today, all from different disciplines: medicine, economics, and public health. but all who have a deep knowledge on health and equity and gender and implications on well-being. I'm going to give a quick introduction, but their bios are on the conference website, and I encourage you to take a look. We're going to start with Dr. Jave Crooms, who is an assistant professor in the Department of Economics at Howard University, but she's currently a visiting scholar at the Saul Price School of Public Policy at the University of Southern California. Dr. Dara Mendez is an assistant professor of epidemiology at the School of Public Health at the University of Pittsburgh, and she's the founder of Health Justice Scholars and Maternal and Child Health Equity Scholars, and is joining us, I think, from Pittsburgh, if that's right. Yeah. And then Dr. Lauren Robinson is the Chief Medical Officer and Vice President for Medical Affairs at Christus St. Michael Health System in Texarkana, Texas, where she's responsible for the hospital's quality and safety efforts, as well as physician recruitment. And may I add, Dr. Robinson is a Spelman College alumni and currently serving on the Spelman College Board of Trustees. To be honest, we could spend hours on discussing what we've learned about COVID, what it means in terms of health and well-being and employment. We've learned a lot about where the fissures are, a lot about where the fractures are in our system, particularly in the intersections between health, employment, and well-being. And we saw quite rapidly the implications of the pandemic right away as workers initially lost their jobs. And a lot of those workers were women, and a majority of those were women of color. So right away, many of the issues that we're going to be discussing today were evident in the beginning of the pandemic. So unfortunately, we only have half an hour to discuss an issue that we could discuss, and we were actually discussing earlier, and we could discuss all day. But what I'd like to do is spend a little time today talking about what we've learned, and then shift the conversation and talk about some solutions, because I think that's the focus of today's summit, is to really think about how we can change and improve and strengthen the system we have, both in terms of employment and in terms of health and well-being. So with that, I'm going to open this up to the panel. But what did the pandemic teach us about the intersection of gender, race, health, and work? There's a lot of topics that we can cover. Can we hear a little bit about mental health? Dr. Bruce, do you want to?
Yes, so, okay, I will get into mental health, but I think the biggest takeaway I know that I took away from COVID and the Black Lives Matter movement is there are fractures in our system that existed far before COVID, right? Structural racism, COVID and the Black Lives Matter movement, it just amplified what a lot of us already knew existed, especially a lot of us in Black and brown communities. And what I think it helped us do, and hopefully will help us find answers, is to put a magnifying glass on the problems. And it made the rest of America have to deal with the problems that a subset of America has been dealing with for generations, right? But when we think about mental health, I've done some research and we've done some surveys. And one thing that I think was really surprising that we took away from the mental health research is that mental health seemed to have a more significant impact on Black and brown communities than non-Black and brown communities. And that didn't matter about exposure to COVID or non-exposure to COVID. We think some of the driving forces behind this is employment. When COVID first hit, there's a saying that I've heard economists say time and time again: the first to get fired, the last to get hired, Black men, right? And so you can think of communities that typically have higher unemployment. When something like COVID happened, they had more stress. They feared job loss. With less savings, with less security, what are they going to do when they lost their jobs? And we also know women represent a lot of frontline industries, a lot of low-paying jobs where they interface with our population and are at greater risk of contracting COVID. So those individuals that had higher stressors were those individuals that resided in Black and brown communities, but also women who bore some of the biggest brunt of the COVID pandemic.
Yeah, and we actually, Kaiser Family Foundation does a lot of polling. We saw that over and over again, that women, and particularly women of color, were really feeling the stress. Dr. Mendez?
Yes, I'll echo what Dr. Groom said in terms of
what I say is COVID was the tip of the iceberg, right? So if we think about the fact that these inequities in multiple systems existed, our economic system, public health, healthcare, transportation, housing, what we consider sort of these social determinants of health as well, that all of those things existed for quite some time. And COVID exacerbated that, tremendously. I think very early on, from my perspective in public health in particular, and I always joke, that as an epidemiologist, trained epidemiologist, people now know, more likely are to know what an epidemiologist is, right? Like I don't study skin, right? But I look at these trends and data, and I'm trying to understand what's happening on the population level. And so what was really critical, I would say, in our public health system is really thinking about the ways in which our systems enhance health across populations, right? And what are the ways in which we do this to address prevention? Another key area is that the things that many of us have been advocating for quite some time, we're capable of doing it, right? Because we have done some things in the short term, even with, some of the policy interventions. I'm in the area of maternal child health specifically, right? So we have expansion of postpartum care for some areas in which we know in the area of pregnancy and maternal health specifically, that any sort of adverse outcomes that may occur during pregnancy can be exacerbated and continue on beyond the pregnancy period. And so we have gaps in coverage that don't allow for, populations to be able to receive the support and care that they need. And in addition to that, when we think about the impact of COVID, right, we don't know the long-term implications of COVID. So what does that mean for our larger public health system when we have populations of people that have been disproportionately impacted? That's Black women and femmes, for example, and the long-term health consequences. What are the systems that we're willing to build and address to ensure that the populations that are disproportionately affected will be supported beyond this year, right? We have changes now, I think it's as of, correct me if I'm wrong, the 25th, right, or this week, in which those who are uninsured will no longer receive, free testing. We know that there are some things coming down the pipeline with respect to vaccinations as well. So what are the ways in which we're addressing this from a larger public health perspective?
Yeah, I think that's really a critical issue right now. We built some things that we're about to dismantle, and we need to make sure that we protect what's there. Dr. Robinson, you have been on the front lines of building a response in a health system, as well as providing patient care. I'd be really interested in your perspective.
Thank you so much, Alina. I think it's fascinating. This has been a couple of years unlike any that we've ever had in anyone's current lived history. I think there are definitely a small amount of folks who lived through a pandemic earlier in the 1900s who are still around. And they probably think they did it better back when they were young than however we came through it this time. But I think to Dara's point, Dr. Mendez's point, the health piece of this, I think everyone thought that was going to be the big hit, right? The big hit was that COVID is here. It's the scary virus. So many people are going to get it. It may be a zombie apocalypse. Who knows? All we know is that health as we know it is never going to be the same. And I think for sure, health as we know it is not going to be the same. But I would say that the economic impact of this, the ripple effect of that is going to last so much longer than the health consequences. And that's not to minimize anybody's lived experience of COVID-19. So lots of people lost family members, older, younger. At the very beginning, it's so fascinating to hear what we thought would be like definitive risk factors for COVID. And so many people are like, well, I'm not older, so I should be fine. And now 2 years later, we know kind of how wrong we were. But I think there's quite a few pieces. So I think as we look at those who've served on the front lines, people are tired. A lot of our nurses, who are primarily women, are tired. And so some of them left and decided to do travel nursing. And that kind of rejuvenated them. It paid much better. But now they don't want to come back and work in the hospital. It's going to be fascinating to see when we kind of try to return nurses to the rate that we paid them before, which probably wasn't enough, to see if anybody's going to take that. And I can tell you for right now, as the hospital is trying to recover our nursing workforce, people are not doing that. So even in Texas, where it's so hard to talk about living wages and all these different things and all these back and forth arguments that were taking years and years and years, all of a sudden in COVID, we can have that conversation. It's like, yep, we're moving to a living wage and we're going to do it tomorrow. And in medicine, we moved to telemedicine. I had all these monthly steering committees where we talked about, we can't do that. And then COVID hit, and in 2 weeks, it's like, well, use your iPhone, FaceTime, we'll figure it out, because we need to keep people safe and serve them. I think as we talk about the health impacts, we're talking about, we know that if you get COVID, it negatively impacts, especially our marginalized communities. I'm very passionate about maternal and infant health, and so we know about increased maternal mortality and infant mortality, but I can guarantee you that we have not even, because we just haven't had time to really do the research, we have not even seen how terribly COVID has widened the gap in our health disparities. And as it relates to maternal mortality, I can't even begin to think about what that gap is about to look like, which is why I think this is just such a right time for us to expand the programs that we know work. In our hospital, I work with a lot of our OBGYNs, and we talk about maternity care, and they're talking about hemorrhage protocols, which are very important. And we know that postpartum hemorrhage is something that we can kind of act on in the moment and make and take a stand. But what I don't think the medical community has moved on yet is understanding how systemic racism also plays into health disparities. And as we look at maternal mortality, we know that that's a fact. And so, trying to help clinical providers understand that beyond making sure you have a hemorrhage cart with some things to pull out, you also need to have a toolbox to help you understand how to address systemic racism that has plagued your patients before they showed up on your doorstep, and how we do that in the acute setting in the hospital, which is where I'm located now. So I think that's going to be an opportunity, and I think we have ideas about what works, and I think now is when we implement those. And when we do that, you kind of build this buffer so that when you have this next pandemic, and it's not an if, it's a when. So when the next pandemic comes, you're kind of bouncing off that buffer, and that buffer is extended maternal, and paid postpartum or maternity leave, paternity leave, partner leave. And so I think those are just some of the things that we know work and need to fund and make sure are in place.
Well, that's a perfect segue to the next part of our discussion. And I think that, from my perspective, I also think that even way before the next pandemic, there was so much that was broken that we need to fix, that we're going to need to fix in response to this pandemic, but also things that were, simmering, and actually in some communities in flames that we need to address, that I think now we really have a unique opportunity. I'd like to shift now to a little bit of kind of policy responses. The focus of this larger summit is to think about, identify what needs to change, what we need to improve. We can talk about healthcare access and coverage. Let's start there a little bit and then move to kind of other broader systemic change. What do you see as kind of the role as kind of government? I know that state and federal government have a role, but also the private sector as well.
I'll jump in. I have, so Dr. Mendez made a comment about free testing expiring this week. And so to piggyback off of that, not only free testing running out, but, traditionally a lot of people think those individuals that don't have health insurance are those that are unemployed, which is not factual. The individuals that, in a study we've done with me and co-authors, we found that of those that are employed, the most likely to not have health insurance were those essential non-healthcare workers. Those individuals that made the world go round during the pandemic, that made sure we got our groceries, that made sure the buses were still, and those were the ones that were more likely to lack health insurance. And it was, for Black and Hispanics, it was about 10%. For individuals that were white, it was lower to the 2 to 3%. So it is really disproportionate. So I think a big push is just not government-sponsored health insurance, but companies need to take it. They need to take ownership and responsibility in making sure their individuals that work for them get basic needs met, and that is living wages, but health insurance. My husband and I, we had some health issues this last year, and we looked at each other and we're like, I can't imagine if we didn't have health insurance. We'd be hundreds of thousands of dollars in debt, right? Like, I can't imagine. And to think that we have a good income that could cover these expenses, but we also have health insurance. And there's people out there women of color who may be single households, working 40 hours, more than 40 hours a week, and they lack health insurance. They can't get their basic needs met. And that to me is a real big concern that we as a country need to fix. I don't know necessarily the policy solutions, but companies need to take it upon themselves to invest in their employees.
Anyone have anything else they want to add on the issue of coverage? I would totally agree that, you know, that's one of the areas that kind of came through pretty clearly. And I think that the fact that we had a block on states dropping people who were enrolled on Medicaid was an important safety net. We're potentially going to lose that now. That also affected women who had children with Medicaid. They now have had continuous postpartum expansion, but that is also, as you were mentioning earlier, probably going to end pretty soon unless the state has either decided to expand postpartum or has expanded Medicaid. What about, is this the role that you see for employers? What about for the federal government or state government?
Yeah, absolutely. I mean, I would say on multiple levels, right? When we think about the pandemic and it's in the decision-making processes around, you know, we can take the mask related recommendations as an example, right? We can think about that from the federal, state, and local governmental level, because they all had a stake in how that would be implemented in their local communities, right? And so I absolutely believe that the state has a role with respect to larger public health infrastructure and decision-making. Where the resources go from an equity lens, I think was really critical that we saw from the pandemic. You know, locally, I'm based in Pittsburgh, Pennsylvania. Many of us in leadership, Black leaders in our region, right? In the public health space and economics, business leaders, artists, we came together and said, no one is going to address this issue on our behalf. We need to do it. So we formed the Black Equity Coalition. And key partners were from the government, but we had a way in which we needed to communicate to them, this is what is happening on the ground, and this is what needs to happen in terms of their decision-making processes on the county level and the state level. So that was really critical. That relationship, I think, is important because those resources do flow on multiple levels, and those entities make decisions about our lives, right? And so when we think about even the recommendations now around masking, right, we can just take that as one example in terms of mitigation strategies related to COVID. We know that those recommendations will then flow to multiple levels for individuals and communities to make decisions, right? And so if those folks in those positions are not doing this from an intersectional or equity lens, other folks are being left out. So we know right now that children under 5 cannot be vaccinated. Immunocompromised people cannot as well. And so the argument around masking being, you know, dropped or released or unnecessary really doesn't address the needs of people who are most vulnerable right now. And so I think that's a larger conversation as well that I think is really critical when we think about the role of government in decision making.
But what I'm hearing you say as well, though, is that the government needs to hear the voices of the community.
Not the people.
It's not just the government. There needs to be a bridge, and that, you know, that involves an organizing force with the communities as well.
Absolutely.
Dr. Robinson, it looked like you were going to jump in there.
Yeah, no, you know, I think one of the things that we did at Christus actually, and I think we were probably working on it, but maybe COVID sped it up, is we've started, and we're definitely not the first, but we started doing social determinants of health assessments in our ambulatory clinics. And so I'm doing a presentation for our system-wide for our doctors and nurses next week. And one of my slides says, whose responsibility is the social determinants of health? Because everybody always wants somebody else to do it. So like, could the nurse just ask the question so I could just see the patient? And my response is that it's everyone's job. And so, that's just so that the doctors and nurses know it's both of your jobs. But I think for this conversation, it still is everyone's job, right? So government, healthcare, public-private partnerships, you have to do that. Every single person has to think about that and think about how they can play a part, because that's the only way that it works. So you've got to have the government support of these community programs. You've got to make sure that private entities are connected with public programs. As we started to try to figure out how we were going to vaccinate people in East Texas, because at the beginning people were actually interested. Everybody wanted one at the very beginning, the first day, just like we were all wearing masks in Texas the first day. But as time has gone on, that's kind of fallen off to the wayside. But one of the requirements to be a mega hub in Texas is that you had to document a strategy of how you're going to reach underserved communities and how you were going to address disparity and equity in your proposal to be a mega hub. And I think that for our hospital, we're a nonprofit health system, we're a Catholic health system, but for nonprofit hospitals, I think some of that is in our mission and in our work. But if you're a for-profit hospital, this might have been the first time that you thought about it and had to be held accountable to that standard. And so I think it created these public-private partnerships and formalized and helped hospitals understand, like, oh, I actually have to talk to the Black churches. I can't just show up for a politician on a Sunday and try to get some votes. I've got to continue to court and support this relationship, because that's the only way that my whole community gets served. And I'm hoping that the relationships that were forged out of trying to survive this pandemic stay intact, because I think those partnerships staying intact, layered with that accountability on all parts, really is how you start to address the social determinants of health, including systemic racism, that will help us recover and respond to crises.
I want to talk about, oh, sorry, did I cut somebody off? No. I want to talk about some of the larger structural issues, because I think that's critical. But do you see any kind of low-hanging fruit? What are some things that we could do today to address some of these issues, these inequities that we're seeing? I mean, I heard about kind of empowering communities to have a voice.
So something I think could be useful, and this is probably like the more obvious one, is my husband and I, we have 2 sons, and we say we're raising feminist boys, feminist men. And I think that it's not just feminism, but it's also understanding, teaching the younger generation and not glossing over that women, minorities are disadvantaged because of what has happened in the past, right? Like it's not a surprise that COVID affected us the most, right? That affected women and minorities the most, right? Before COVID, we were the most disadvantaged. There's generations. And so I think making sure everyone is aware, right? It's not one person. The government can't solve the problem. Everyone in America has an invested interest in improving the structures. And so my very simple one is teaching kids early, right? That what's going on, so that when they become, when they run hospitals, when they become elected officials, it's something they're aware of and something they're knowledgeable about.
And I think ownership to that too, right? Yeah. I think, so one of the things that Chris did when we were trying to figure out how to roll out the vaccine, it's like, okay, well, we have to reach these communities. So we wrote this letter that said, we want to make sure that communities, and I was like, so stop. This letter needs to acknowledge from the beginning that there is a history of systemic racism, that our health system and us as Christus has benefited from that in the past, and we continue to benefit from it right now. And we are committed to acknowledging that it exists and to doing our part to dismantle it. And I think that's the piece, is that anyone who has any power needs to be committed to dismantling it. And so I think, I think what happens in America for so long is like racism is bad. And so everyone's taught to say racism is bad. And then they feel like they've done their job. Like, I'm good. I'm not racist. And I've said racism is bad. And now I can continue on my day. But I guess the bigger question is like, what are you doing to dismantle racism? Like, do you stop that? And there's interpersonal racism, and maybe your piece is just dismantling interpersonal racism. And that's hard and uncomfortable for everyone, but that might be your piece. But as you get into like a systemic leadership role, or as you're talking about structures and processes, you've got to talk about systemic racism and what do you do as a larger organization, and whether that's the federal government, a nonprofit organization, a for-profit organization, what do you do to take accountability for systemic racism, to acknowledge it, to name it, and then talk about what is your actual plan to dismantle it?
Right.
I agree. I just wanted to add one element briefly. There is a book that recently published, edited by Anna Gifty Opoku Ajiman, called The Black Agenda: Bold Solutions for a Broken System, in which scholars from across multiple fields really talk about exactly what Dr. Robinson is saying. I had an opportunity to write a chapter where we talked about re-envisioning public health for Black America. And the key elements that we talked about that Dr. Robinson brought up is really framing out how public health critical race praxis is what we call it, and also critical race theory are central to how we need to think about undoing structural racism. What is the way in which we're framing it? What are the self-reflective moments, right, that she's talking about on the individual level, on the community level, and within the system, right? We think about the fact that those who are within that system have positions of power and latitude to make those decisions, right? It's not some black box over here. No, I'm in a position of power to frame this differently. And so when I mentioned the Black Equity Coalition, it's really centering the voices of the people who are closest to the issue and the solution, right? When we do that, then we are closest to addressing what the next step needs to look like and what that should be. And so I wanted to just elevate that briefly because I think that's critical. I think that's an initial step. It's not the only part of that, but that's an initial step for us to really consider this work.
And just to piggyback off of that, and Dr. Robinson mentioned this earlier, but health is intertwined with a lot of other aspects of life, right? So you see a lot of researchers state this, but it's not just health, economics, education, all of these are intertwined. And so it's really important that we invest in the health of everyone, especially those disadvantaged, because it affects their everyday lives.
Yeah, I think that sometimes it gets framed like it's a zero-sum game, but it's actually everybody. If we elevate we bring everybody up and really bring people up. That's going to benefit everyone. It's not like it's this or that. We have to do a lot of different things. Absolutely.
Right. And when we create a system or ecosystem that's really attentive to those who are most disproportionately affected, we are creating a system that works for folks who are also, advantaged to some degree. And so I think that's really critical as well when we're thinking about addressing equity in the larger systems at play. And as Dr. Grooms mentioned, these are multiple sectors, multiple systems coming together to affect health and well-being along the continuum in the life course.
Well, we are running out of time. We have a couple of minutes left. I'm going to give you each a magic wand. What would you, this could be a big thing or a small thing, but what would you like to see kind of in terms of a change that would affect and improve women's well-being? I guess the focus is economic well-being, but I think they're all absolutely inextricably linked. So.
I'm not an expert in this. Dr. Grooms may be able to speak to this, but reparations, right? An intersectional approach to reparations, right? We're talking about not just COVID right now, but the historical context of what we've described over the past, centuries, if you will, of our history and what that means moving forward. And so I would say that would be my sort of short and straightforward answer to your question.
Dr. Robinson?
I'm an and person. So I want a living wage, universal high quality pre-K and daycare, and paid maternity leave. And I think it's got to be universal. I know, a lot of things, people are like, oh, the federal government passed this, but that's for federal government employees. So, it's fascinating to me to work at the hospital. It's like, okay, yeah, you can take your vacation time, but like, that's how you pay for your medical. I was like, but wait, how can I have just testified on Capitol Hill and like work with John Lewis on talked about Black maternal mortality and you guys don't have maternity leave? So I think, and it was the same when I was in Pennsylvania state government. And so I think people assume that these things exist, but most of them exist in very few number of almost like Fortune 10 companies. So there are so many more people who don't work at those companies who need to be provided for. And I'm like, okay, if I'm in a point where I'm comfortable enough to be able to take care of myself and do these things, but all of these people who work in my company don't have this as a benefit, then it's not a benefit at all. And so that's what I would wave my wand and grant.
And Dr. Grooms, you have just a few seconds.
So since they've all addressed the big issues, I think my big one would be better access and better acknowledgement of care when individuals, Black and brown women, go to doctors. I want them to experience better care, less bias, whether it's explicit or implicit bias, so they can get better treatment, so we can ensure that the health of everyone is equitable and it's not disproportionately disadvantaging certain populations.
Well, I'm ready to hand you all real wands. If I had them, I would give them to you. I want to thank you for a fantastic discussion today, and looking forward to great discussions for the rest of the day. Thank you.
Thank you.
Thank you.
Hello everyone, and welcome to this session on solving the gender pay gap. I'm Professor Rosie Campbell, Director of the Global Institute for Women's Leadership at King's College London, and I'm thrilled that you're able to join us here today. First, we'll have a presentation from my colleague, Aleida Borges, a research associate at the Institute, on our gender pay gap research, and then Julia Gillard, my boss, the chair of the Institute, and former Prime Minister of Australia, and the only woman to hold that position, will have a conversation with Anne Carnes, the Executive Vice Chair of MasterCard, and they'll be talking further about gender pay gap reporting and what governments and businesses can do about it.
Thanks, Rosie. So how do we push for progress on the gender pay gap? At the Global Institute for Women's Leadership, we conducted a study in collaboration with the Fawcett Society, and we looked at 6 case studies globally. This included the United Kingdom, Sweden, Australia, France, South Africa, and Spain. We interviewed over 80 key stakeholders, which included government officials, employers, trade unionists, academics, as well as gender equality advocates. And we analyzed the current legislation, but also academic literature more generally. And what we found was that there was a great variance across the different case studies. So we looked at different indicators, which included accountability, transparency, penalty enforcement, intersectional lens, as well as employer size. And we found that France and Spain, for instance, stood out for their action-driven frameworks, which meant that they were not necessarily just focused on identifying the issue and diagnosing within companies what the problems were when it comes to the gender pay gap, but they also focus on actually fixing the problem. So having action plans that can actually correct the issue around gender pay gaps. South Africa innovated by its approach on centering on intersectionality. Given the history of the country, they found that focusing on pay gaps more generally was a much more important tool than just focusing on gender separately. The UK, on the other hand, excelled really in its transparency and high compliance rates. However, the legislation was found to have no teeth, because whereas it focused on monitoring the problem, it didn't necessarily have an aspect of solving what do we do to deal with the gender pay gap. And so there was great variance across the different countries, and the rating really tried to capture this diversity, whereas really recognizing what the key actions needed to be when it comes to tackling the problem at its core. And so our recommendations for governments include starting with the question of having a legal obligation to publish action plans. So beyond just requiring that companies diagnose and that identify what the problems are, that they also commit to actually solving it. So what can be done to solve the problem internally in this company, and focusing on key achievable goals that can be done within a particular time frame. And some countries like Spain focus on that, as well as France, and we thought that that is the way forward. Another important aspect here is including all employers. Sweden has this approach, whereas countries like the UK, for instance, target companies that have 250 plus employees, and we find that that's too big of a company and excludes quite a lot of players in the field, and especially considering that some sectors have very small sizes. Also, the question around fines and penalties. We found that it was quite important that there's a dimension of automatic fines that are included in the mechanism, so that when companies don't submit reports, there are consequences. So automatic fines for non-submission of reports. And lastly, we recommend that companies work towards increasing the capacity of its bodies so that it can provide better guidance and support, as well as conduct more rigorous monitoring and analysis of submitted data, so that overall the framework is working in a holistic way to tackle this very complex problem around gender pay gaps. Thank you so much, and over to you, Anne and Julia.
Well, Julia, I mean, we've heard all of the data now from Aleda, and what do you think governments should be thinking about in particular with respect to this gender pay gap?
Well, Anne, I wish the data made happier reading than it does. I think it reinforces just how much we have to do. I think the real force of this research is to say that governments should be adopting ever more stringent gender pay gap reporting legislation. Various countries have various systems, but no one's got this entirely right. And if we do have better systems, then it will mean that companies are transparently held to account. And I do think that in this world where companies are worried about their reputation with consumers, worried about their reputation with other businesses, and who are fighting for talent, businesses want to be known as the kind of place that is addressing gender inclusivity and gender pay gap differences. So getting down to real practical steps, you know, companies have to get to grips with their own data. They've got to work out what's going wrong. Is it that women are segmented in a lower paid part of the business and they need to think about how to recruit more diversely across the business? Or is it an undervaluing of women's skills that's been historically baked in to the pay system? Or is it a promotion pyramid where the women start in same numbers as the men at the base, but as they go up, more and more of the women are lost, which is often about how promotion systems work, networking is undertaken in the business. It's also about work and family life policies. So all of these things have to be on the table for positive change.
I absolutely agree with you, Julia. And I don't know what your thoughts are on how low we should go in terms of numbers of people in any particular business reporting. I know here in Britain, we report for businesses that have more than 240 people, but there are many, many businesses that are below that, and they're sort of flying below the radar. And it's certainly that was something they should be thinking about, especially if they're scaling up. Don't you agree?
Yeah, I do agree with that. And we're missing out so much of the workforce if there's a cut-off. I mean, in dynamic economies around the world, so much of employment is in smaller or medium-sized businesses. And indeed, so much of women's employment is, because a lot of the sectors that are highly feminised, whether it's hospitality or tourism, even childcare can often be done in very localised services. And if we're not doing gender pay gaps in those sorts of places, then we're missing out literally on billions of women. So I do think that the footprint of gender pay gap reporting and holding people to account needs to be as big as possible. I'm conscious though, Anne, your expertise and career has been spent in very large businesses, global business in MasterCard. From all of your experience, what more do you think that, you know, big businesses, global businesses that are reporting in more than one jurisdiction, what more could be done?
Well, first of all, I think if you're a global company like MasterCard, you do have to have policies that work everywhere in the world. And we're in over 200 countries. And so from our point of view, when we do roll something out, we try and do it on a global basis. So for example, maternity and paternity leave, we've rolled that out everywhere in the world. And it's 4 months for men and 4 months for women. And it's longer than that if the jurisdiction rules are longer than that, for example, in the Nordics. The thing that's interesting, I think, is when you put a policy like that in, you stop looking at a woman as she's going to be a young mother, and you start looking at young people thinking they're going to be parents. And you've immediately started leveling the playing field there. And of course, it applies to single-sex couples, to surrogacy, adoption, and so on, because I think when you have policies like this, you have to be very broad. So that's one thing. But the other thing, going back to your commentary about, building that pipeline, about transparency, I think actually publishing your gender pay gap all over the world is important. And if you do that as a PLC, then whatever number you give to the market, you want to better that number the next quarter and the next quarter. And that's just the way of the business world. And so I think that's a great thing to do. Lately at MasterCard, we've actually linked that to executive compensation. So if the gender pay gap narrows, we get better executive compensation, and vice versa. That's true of the whole ESG agenda for us, which is, I think, one step beyond many other companies in this space.
That's incredibly important, that this is not something that's done on the side. I think that that's an error that is made in a lot of businesses and indeed in a lot of policy thinking. I think many governments probably think to themselves that there's their, core political agenda. They want to do the following things in the economy and national security and health and education. And then over here, there's women's policy, rather than looking at those big levers for change that government has in their hands and saying, how do we look at gender and gender equality across all of these spaces? And how do we design policies using those big levers that make a difference? I really think you've hit the nail on the head too with equal entitlements for men and women. I mean, the research very clearly shows that if family-friendly flexibilities are seen to be something for women, and it's only women who use them, then women do end up on the mummy track and cease to be thought about as high-performing talent that should be nurtured, that should be promoted. They're sort of, on a pathway to not very much in terms of their career, whereas men not taking those flexibilities are still seen as promotable. Yet if both men and women use those flexibilities, then no one's career suffers. So that equaling of entitlements, I think, is so important. From the perspective of a global company, do global companies look to the periphery? Do they look sideways and see what the other global companies in their sector or more broadly are doing? Is there that sense of competition that can be spurred by things like gender pay gap reporting because you want to beat your competitors or beat the global market players more generally?
Absolutely. I mean, I think in the corporate world, that's what you do all the time. You're constantly scanning the marketplace and you're looking at the results of other companies, and you're looking at who are the people who are running those companies. And certainly there's a lot of data out there to show that if you have diversity right at the top of companies, you're much better at managing risk. It's hardly surprising because you've got a lot of different voices at the table. And if you are in the middle of a crisis, and goodness knows with everything that's happening around the world, we've got a lot of things to think about, from inflation to war in Europe right now, unfortunately, to, coming out of the COVID pandemic and still having restricted movement around the world, to a whole new world of work, really, and what's happening in the consumer markets and so on. So there's many things for business to be thinking about now. And of course, the strongest businesses are those with the most diverse management team, strong in terms of risk management, and also have been shown to be outperforming in some areas in terms of financial returns as well. But as you say, it's not just financial returns that matter, it's how you actually manage all of your stakeholders. So firms today have to think about, how am I managing my people? How am I delivering my products to the whole of my customer base? What's the society that I'm living in? What am I doing in terms of purpose to affect that in a good way? Because it's really true that you can't be a successful business in a failing world. And I think all of the business world are thinking that way now.
That's a very important statement. You can't be a successful business in a failing world. Of course, one of the things that you mentioned was, as not everywhere, but many places in the world feel like they're emerging from the pandemic and the rhythms of work are moving beyond lockdowns and the need to get people to stay home to stay safe. I think a prospective area as we talk about gender pay gaps is what this future world of work is going to look like. I mean, many jobs require personal attendance and that's not going to change. But for those sections of the economy, those jobs where you can perform them remotely, doing the kinds of things that we're doing now, I think that there's a really big thought piece that we need to do about how to best design the future of work so that it is more gender inclusive and helps close the gender pay gap. One of the things that we've been looking at the Global Institute for Women's Leadership is how to design flexible, virtual, remote work so it's gender inclusive. We're really fearful of a future where employers say to their employees, we want to give a lot of flexibility, which sounds absolutely fantastic and would be coming from a generous impulse from the employer. But if we fast forward the clock, we end up in a world where, because of unequal distribution of caring responsibilities in the home, disproportionately women work virtually, disproportionately men go into the office, and that then creates a new form of segregation which plays into promotion opportunities and ultimately shows in the gender pay gap. What do you think are the risks and opportunities in that future way of working space?
Well, I think that you've outlined the risks very well about that some people are in the office and others aren't, and it tends to sort of split along gender lines. And if you actually do questionnaires about this, you actually see this happening in the workplace about women saying, I would like to continue, working from home longer, and some of the men saying, I'd like to come back to the office. So that is definitely a reality. And we all know that in order to get promotions, it's not just how you perform, but it's the networks that you build. You and I actually saw each other about a week ago and were sitting together for dinner, right? And it was a really nice occasion because we could communicate to each other as people, and all of the body language and so on that you lose here on the screen, you pick up again. And it's a good feeling. So I do think that firms need to be very, what do I want to say? They need to be careful in the sense of, if they say we want our people to come in 2 or 3 days a week, then make sure that that actually happens in the sense of we don't have people coming in 5 days and other people coming in 1 day. So really try and make the policies work. And also, if you're working in a hybrid environment, try and make the hybrid environment work. I've been on conference calls where, a number of people have all been sitting in a room and they're unable to use the Zoom platform properly because they're not seeing the chat. They're chatting among themselves, but the people who are on remotely are then chatting among themselves on Zoom. Put something in place where it allows you to actually interact with each other in the same way, whether you're virtual or physical. And there are things being designed like that now in boardrooms that I've been in, and I think they can be quite effective. So really thinking about the redesign of the working environment, rather than, we can just patchwork quilt what we've half got and other people can get on with something else because they're sitting next to each other. That really doesn't work.
No, it doesn't work. And I think we all urgently had to adopt, ways of working in the pandemic. But as we get a little bit more time and space, it has to be more thoughtful than that. I mean, it seems to me, even as we're talking about all of this through the lens of gender, some of the research recommendations are calling to us to think about how we look at the intersection between gender and race, and that disparities at work are obviously not just described around gender. So what's the best way of doing that? I mean, we at the Global Institute, through this research, are talking about employers being asked to also account for disparities based around other characteristics at work, including race. Do you think that that's feasible? Do you think businesses are open to doing that?
Look, I've got to say absolutely yes to that question, because, you know, certainly in my company in America, we've been able to report that way for a number of years. So it means that we can't, you know, we're not just in a situation where we can accurately report our gender pay gap around the world, which is about 8% on a global basis, but obviously varies country to country. But we can also report our Black American pay gap, which is somewhere over 7%, slightly less than the gender pay gap, actually. And there's no reason that we couldn't do that in other countries. I mean, Britain's a very multiracial country, and the people that I talk to have said that they would be fine with self-reporting, and I think the data would be good enough to do analysis based on that. And of course, self-reporting allows you to do many other things beyond race as well. I mean, so I think it's very important. I've been involved in a study with another university recently on the barriers faced by Black women actually trying to make it through the corporate ladder in Britain, and they're quite immense. You know, I mean, they're basically in the top 1%. You know, you start to be 0.01%. You know, they're virtually missing from the corporate world right the way through the pipeline, actually, but certainly at the top. And I, you know, as chair of the 30% Club in 2020, we put something in Britain where we went out to all of the chairs and the CEOs of the 30% Club and said, you know, apart from trying to get to that tipping point of 30% women on boards, which we've exceeded now at the FTSE 100 and are heading to 40, which is wonderful because our real aim, of course, is parity. How about combining that with getting at least one person of color on every board, which is what the Parker Review called for. And because we're the 30% Club, let's put that gender lens over it and say, we'd like 50% of those seats to go to women of color. Well, the CEOs kind of rang me up at that stage and said, Anne, you know, since we all have to commit to this, is this for real? I mean, can we actually achieve it? And I said, well, the good news is you're already tracking at 42% of those people of color, 42% of them are women. Now, of course, that is a broad category, people of color, but you have to start somewhere, you know, in a community. And I think by actually setting out clear goals and then pushing beyond that, that's how we cause change.
Yeah, and interestingly, the mechanism for change that the 30% Club has employed is really the mechanism for change that's embedded in gender pay gap reporting. I mean, it's the same, isn't it? You're clear about what it is that should be measured. You require the measurement of it. You hold it up to the light so that everybody sees it. You've got a clear target about what you're trying to achieve, and that does generate the pressures for change. It obviously doesn't just happen magically. It's not just like add these ingredients and stir and then somehow this big change happens. The 30% Club's done so much campaigning and advocacy and published so much research to prove that it's in the interests of business themselves to have more diverse boards. But it really is the same kind of combination of elements that could make world-class gender pay gap reporting such a great tool for change.
Completely, Julia. And I think the key, one of the sort of secret sauce ingredients is that it's actually the CEOs and chairs that sign up for it. And if you get that rather than mandated change, then what you get are people who are committed to causing the change. And that means causing a change in the whole corporate culture. Because to actually change the workforce in that way, you do have to change culture. And that's much harder, as we know. But if you achieve it, then it's sustainable rather than, oh, I'm just going to obey whatever rule is laid out there, perhaps by the government or whomever. And by the way, going back to government, I think government should absolutely be looking at themselves. And saying, you know, not be sort of telling industry what to do and then ignoring the rules. As we know, there are so few women in power around the world, and yet we know that things such as peace agreements brokered by women historically have lasted longer. And we certainly need things like peace agreements brokered today. You know, I think really government fixing itself is a good step forward, don't you?
I really strongly agree with that. I mean, we've canvassed in this discussion so far, you know, one role of government, which is its role as a legislator, regulator, setter of corporate norms and rules, and that's an important role. But of course, governments are also very big employers, and unless, you know, that those sectors are tracking towards ending gender pay disparities, then you can't achieve it for the whole economy. And, you know, if anything, the pandemic has certainly taught us a lesson in the value of the caring work that happens in government. I mean, no country on earth would have got through without its healthcare service. Obviously, here in the UK, we talk about the NHS. In Australia, we talk about Medicare and public hospitals. People have got their own labels, but all around the world, the people in the front lines of that caring were women. And historically, their work has been undervalued because it's been viewed as kind of, you know, caring work is women's work. Somehow it's innate to women, and so it doesn't need to be properly paid, properly rewarded. So I think, you know, government getting its role as an employer right is a vital piece. And then, you know, who is the government? You know, the government's made up, as you say, of individuals. And if women and men in democracies can't look at their parliaments and governments and see the full diversity of the community represented, then just like we make the case for business that more diverse teams mean better outcomes, more diversity in politics and more fairness about who gets there and gets the opportunity to lead obviously is going to lead to better outcomes.
Couldn't agree more. So we need it everywhere. We need it in government. We need it in business. And the good news is that it seems that everyone that you talk to in the community agrees. We're not, you know, I don't see the pushback that, you know, I heard 10 or 20 years ago. What I see now are people saying, how do we get there? How fast can we get there? And that is actually something that's a little bit depressing post-COVID, because it does seem to have gone backwards in the last couple of years. And it's something that we're going to have to take much more action on in the next couple of years to correct and get back on that trajectory.
Yeah, I agree with that. I mean, certainly the labour force participation statistics in many parts of the world, the so-called Great Resignation, is telling us a story about who's stayed in and who's exited the labour market. And there's a very skewed gender analysis there. You know, unless we are very active around these gender pay gap reporting, change in the workplace, future ways of working, then we could see that tendency exacerbate over time. So my sense is that there is a great deal to do, but some good examples of best practice to learn from, some good comparative studies, and we're deepening the evidence base, which of course is what the Global Institute for Women's Leadership is so determined to do. You know, if we really are in many businesses, not everywhere, but in many businesses, if we're really at the stage of answering the how question, then that does require very good evidence leading to good toolkits for change. And that's the aim that we've set ourselves.
Fantastic. Well, I love being part of this, and I've absolutely loved talking to you this afternoon, Julia. Fantastic.
Thank you very much.
Thank you.
Hello, everyone. I'm Layli Mapayan, Executive Director of the Wellesley Centers for Women and Professor of Africana Studies at Wellesley College. I can't tell you how delighted I am to be able to sit down with today's guest, Dr. C. Nicole Mason, to talk about women in work. Nicole is the President and Chief Executive Officer of the Institute for Women's Policy Research in Washington, D.C., an organization that WCW considers a sister research institute with whom WCW has a long collaborative relationship. Nicole stepped into her role as head of IWPR in November 2019, right before the pandemic, and she is the youngest person currently leading one of the major inside the Beltway think tanks. She's also one of the few women of color to do so. For the past 2 decades, Nicole has spearheaded research on issues relating to economic security, poverty, women's issues and entitlement reforms, policy formation and political participation among women, communities of color, and racial equity, emerging as one of the boldest and most insightful voices in our national conversation. In recognition of her thought leadership, Nicole was recently named one of the world's 50 greatest leaders by Fortune magazine. In May of 2020, Nicole launched a movement when, in a New York Times interview, she coined the term she session to describe the unique contours of the pandemic-induced economic crisis. Nicole, let's start with that. Because a lot of people who are listening will be excited to meet the woman who launched the whole she session analysis, who gave us the language to talk about what we were seeing and living during the pandemic and what we're still seeing and living even up to today. So can you talk a little bit about the moment when that term she session crystallized in your mind as an explanatory framework for the very unique, yet up to then unnamed, ways that women, especially women of color, were uniquely affected by the economic dimensions of the pandemic?
So first of all, I want to say thank you for inviting me, Layli. And I remember when you stepped into your role. So I feel really privileged to be speaking with you today about my work, the work of IWPR. So at the beginning of the pandemic, IWPR, as a think tank that looks at the economy at the intersections of race and gender and other markers of difference, I noticed right away that women were losing jobs 4 times as fast as men, and the jobs that we were losing were in predominantly women-dominated sectors: leisure, hospitality, retail, education, and health. And reporters at the time were really trying to figure out what this meant. So they were asking a lot of male economists about this moment, and nobody yet had an explanation. But I knew that we were seeing something different. I knew that women were being impacted and women of color were being disproportionately impacted because they were overrepresented in those sectors. And so I started to call it internally a she session, and with our network, and I was saying, this is our moment. We have to frame it so that people know how to talk about it. It's different than 2008 because that was the framework we were using to talk about what we were seeing in this moment. And so when I was being interviewed by the New York Times, I said, I think we should just go ahead and call it a she session. And I thought it was a throwaway because I'd been saying it for about 3 weeks at that point. Like I had been saying it and nobody had picked up on it. And so the New York Times printed it, and that's how we became to frame and understand the moment.
Well, that's a funny story, but it's also really profound. The gender dimensions of economic trends have really been something that we can't ignore. As you alluded to, the pandemic showed us that the economy already wasn't working for a significant segment of the population of this country. In fact, it was a wake-up call for many, but obviously not for those who've been living it. This realization created a kind of momentum in politics and government that made it seem for a while that some very significant change was on its way. For example, with regard to government investment in childcare and the caregiving infrastructure, things that are deeply essential to women's economic participation and well-being. Yet, as we've observed recently, this momentum has largely fizzled out, leaving a lot of people wondering how we can possibly recover and move forward again. So what do you see as our options for making sure that progress is still made on these objectives, particularly in light of the data that IWPR puts out, and who could take it up and put it to work?
So lately, like many of you, I thought this was going to be a moment. We saw, inequalities deepen. The broken infrastructures and systems were exposed because of the pandemic, and so I thought surely our policies are going to align with what we're seeing, and we're going to transform how we think about work, how we think about women in work, and the economy. The care sector, again, care was a big issue during the pandemic, especially for women and families. And I really thought a year ago that Build Back Better and some of the other policies were going to pass because it felt like a no-brainer, and we really made a solid case. And here we are a year or so later, and not much has happened. We are stalled. Build Back Better, or what we call it, the act formerly known as Build Back Better, hasn't happen. And there's a fear that the policies we know that will make a difference for women and families will not come to pass. So the strategy has been to, take it apart and try to advance individual pieces of legislation, get child care and care work policies or the funds for that in the reconciliation bill. But I just want to say that I'm less optimistic about this strategy because it requires a whole bunch of capital, human capital to get these things through. So when I think about what we need to do in this moment, it's not only keep advocating for the policies we know will make a difference, but we have to be honest about why we got up to the line and it was stalled. And it's the people in power, the people who are making decisions and voting down policies we know that majority of Americans support. So there's a lot of things happening here, but a big piece of this is making sure that people who represent us truly represent the majority needs of the country.
Yes, and I'm also thinking about ways that non-governmental sectors can get involved. For example, we know the importance of industry leadership. We know how corporations and even nonprofit organizations have an incredible amount of power to shift the policy environment by the decisions they make for their own workforces. And, I'm wondering if you have any commentary about those kind of options as well.
So in the absence of federal legislation, we know that states have a role to play. They become the innovators in the labs for, policy change. And then I also do think that the private sector, corporations, businesses do have a role to play because, in fact, women are going and seeking jobs in those companies, those organizations right now. So making sure that policies are flexible, there's paid sick leave, family leave, they're paying good wages, there's flexibility. Businesses are on the front lines and will in part determine whether or not women will be able to not only re-enter the workforce, but sustain employment.
Mm-hmm. That's absolutely true. I want to hone in on one of the recent pieces of research that IWPR has done, because I think it's something that we really need to look closely at and pick apart. I know that you've done research about how the gender wage gap has gone down for women overall versus men overall. And yet for women of color, especially Black, Latina, and Asian women, the gap has actually increased. Why is this? And what do these data tell us about how and why these times are amplifying the effects of structural racism and improving fortunes for white women, but less so for women of color?
So lately, if we are really being honest, the truth of the matter is that the pay gap has only closed 20 cents in 50 years. So, it's really glacial. And then when we think about women of color, for Black women, it'll take more than 100 years for the gender pay gap to close. And for Latino women, it's 200 years. And for me, what that means is that my daughter or my daughter's daughter will not see pay equity in her lifetime if we do nothing. But what it means in real time is that that's less money for savings, that's less money for home ownership, and women lose $600,000 in their careers to the pay gap. But Black women, it's $1 million because the gap is much wider. So I think that we need to think about the kinds of policies that we need at the federal and state level, but also in our businesses to accelerate the closing of the pay gap. We cannot afford another, 50 years with 20 cents, in terms of thinking about the gap. And for women of color, what we understand is that during the pandemic, many of them were already struggling. But when you add on the fact that they're earning less, that means they have less savings to ride out an economic storm. It really matters in real time. It's not just abstract 80 cents, 64 cents on the dollar. It's rooted in real life and has material consequences for women and families.
Well, that's a great point. And actually, I want to extend what we're talking about to encompass another hot topic, the future of work. I'm wondering what your take is on this concept and what kind of issues come to your mind when we're talking about the future of work.
So when we were thinking, so we just did IWPR did a recent survey with women thinking about the future of work, and we asked them, you know, what issues do they care about when they're thinking about the future of work? And the top issues were higher pay, paid sick and family leave, flexibility, and job security. And it's directly related to their experiences during the pandemic. They did not have many of those things, especially women of color, because of historic labor market segmentation. And so when we think about the future of work, we cannot just go back to the way things were. We really have to make an economy, a workforce, workplaces that work for women, who are, by the way, 50%, more than 50% of the workforce. And we saw the impact when women leave the workforce in significant numbers, and we just really can't afford that again.
Well, I think there's been a lot of consensus around that at this summit, so I'm glad to hear you sort of weigh in on that. I want to now wrap up with what will probably be our last question, given where we are with time. One of the things that I think has really been most brilliant about your own career is that you chose to write your own story down as pretext to the very important policy-oriented research that you've become known for. For people in our audience who may not know, I'm referring to your book, Born Bright, A Young Girl's Journey from Nothing to Something in America. It's sort of like you have a method where on the one hand, you have real talk, and on the other hand, you have hard data, and it's the perfect combination for bringing everybody into the same conversation. One of the reasons I bring up your book is because, as you know, a focus of this economic summit is young women, their perspectives on what's happening, what they need from this economy, how their needs may differ from those of their mothers, grandmothers, or even older sisters. As a researcher, what trends have you noticed with regard to young women that people, especially policymakers, need to pay attention to? And what does your own experience help you to see about young women's opportunities and threats in this new economic world shaped by the pandemic?
So that's a really good question. So we have, during the pandemic, talked a lot about working mothers, working women, usually women older than, who are not considered younger women. But the truth of the matter is that during the pandemic, the unemployment rate among younger women was more than 20%. So that's the first thing. And so what that tells you, at least for me, is that young women coming out of college or starting their careers have been delayed. And so that delay means there's an impact on earnings, career mobility, and career advancement. And so thinking about in this moment, how we make sure that younger women who were sidetracked during the pandemic or couldn't enter their the field that they trained for, how we make up that time and that gap and make sure that they can, again, close that gap and get to where they need to be. When I think about the kinds of supports that younger women need as they're thinking about their career, thinking about their earnings, is that we need policies like pay transparency, policies that do away with labor market discrimination. Also, by the way, we have to know that for women of color, we still have a higher than normal unemployment rate, higher than white women. And, there's supposed to be all of these jobs available. But the truth of the matter is labor market discrimination is still a big issue for women of color and people of color for a variety of reasons. So really looking at policies that make sure that not only when women of color are entering the workforce, they're treated fairly and with dignity, are now compensated fairly. Those are all things that I think are critically important. And the last thing I'll say is making sure that we clear the way. One of the things I try to do in Born Bright was demonstrate that it's not individual will or wanting to be successful that matters, or access to opportunity. It's making sure that the systems and institutional barriers that make it hard for women of color, younger women of color, disappear, and that we really work on those institutional and structural barriers.
Well, excellent. And I know a lot of people are talking about these things. Nicole, it's been a privilege to have this opportunity to elicit your insights about today's economy. You've made a career out of leveraging data to influence policy on behalf of the most vulnerable segments of our national population. And I thank you, as I know our audience does, for your willingness to engage in a keynote conversation for our summit, as well as for the trailblazing work you do every day. It's been an honor and a pleasure. Thank you.
Thank you. Thanks so much, Laylee.
Hi, Mary Lou. Thank you so much for your time today. I'm excited to be interviewing you. My first question is, can you share your journey with us? How did you get into politics? What motivated you and why?
Hi, Michelle. It's nice to meet you. Thank you for having me. I never thought that I would be working in politics. I actually didn't take a single political science course when I was at Wellesley. It was never really a path that I was planning on taking. But I grew up in Atlanta, and social justice and civil rights is just a really huge tenet of the culture. It's just infused into a lot of what we talk about, and it's a lot of what the kitchen table talk often was. And so it was always been a part of something I've cared about. When I was at Wellesley, I really wanted to be a teacher. And so I taught high school right after I graduated. And I quickly had a lot of frustrations with so many of the policies and decisions that were being made outside of my classroom. I found that I could teach a really perfect lesson. My students could come in with perfect homework, take perfect notes, and do the best that they could. But a lot of the times, all these things outside of the classroom were really having such a huge effect on the students' ability to succeed. So I thought I wanted to do policy, and so I dipped out of the classroom for a bit to try and work on policy. And I found that policy was not a great fit for me, just personality-wise. I like to talk to people and be on my feet a lot. And so I found a good home in political campaigns. And that's sort of my path of how I got there.
Thank you so much for sharing a part of your journey. What did you learn from your experience working with Senator Warren and Mayor Wu about developing and setting an agenda for change, one that will build and sustain inclusivity and support women and families?
Yeah, so something that really shocked me when I first started working in politics is it seems really obvious when you're building policy, when you're writing policy, that you should be including and centering the people who are most affected by the outcomes of the policy. But a lot of times we see elected officials and people in government leadership just writing what they're pulling from their own brain or working with other policy experts and not actually working with people on the ground who are experiencing so much of the pain. And so through both the Warren campaign and through Mayor Wu's campaign, what I really learned is, again, it seems so obvious from an outside perspective, but I learned that it really is possible, and it really is important to, before you put pen to paper on any sort of policy drafting, you should be having tens of hundreds of conversations with people on the ground, with teachers, with students. We talked to high school students a lot. We talk to immigrant elders a lot, people who are oftentimes feeling the most pain from the worst outcomes of policy, making sure you're having these conversations before you're even drafting anything. We should never be writing policy and then asking people to jump on board to support it. It should be written by people and then brought through the process of becoming law.
I see. Thank you for sharing about that. I next wanted to ask, for young people who do not believe politics matters or can affect real change, what would you say to them about the impact of being politically active and engaged? What are some ways for students to get their foot in the door in politics?
So this is a tough question and something that I can't say I have an easy answer to, because it's a constant even for myself, right? I'm always going through these waves of being frustrated with politics and feeling like I'm working really hard and still losing. But I think there are two main things that I would encourage people to focus on. One is really stepping away from cult of personality politics. I think a lot of times we are really attracted to rising stars or people that we really like, that we see in the political world, and we get excited by them. And people are always going to be imperfect, and there's never going to be someone who matches every single thing that you want to see done. you're never just going to have that one-to-one match. And so making sure that we have a little bit of cynicism before kind of throwing our whole selves into really just obsessing over individual people who are politicians. I think that definitely helps me from getting disappointed. And then the second is not necessarily measuring everything in wins. Especially in the political campaign world, you can work really hard, and at the end of the day, there's one outcome or another. It's a 50-50 chance, really. And even if you don't win the campaign, there's so much that you can do in the work of getting people involved, bringing people into the process, really listening to people, having people feel heard for the first time. And those are little wins that add up and continue to have ripple effects. And so just really stepping back from that win-loss binary, which again, hard for me. And then in terms of getting involved and really feeling like your work can have an impact, I would encourage people to really look local. Politics, a lot of times we think about president, we think about our senators, our members of Congress, which can be really far away from us. They get hundreds of calls to their office every day with opinions and asking for them to vote a certain way. But your school board members for your local town, your town council, the people who are really on the ground, helping pave the roads that you live on, getting the funding for the schools that your family goes to, this is where you can have a huge effect, and you can start to have relationships and really build community. Politics should really be built off of community. And so I really think that getting involved locally is a great start. And it's a great way to really start to see your effects, the effects of change happen very quickly. And then in terms of getting involved, especially on the local level, they're dying for people to reach out to them, to get involved, to say opinions. And so really just finding the people who represent you very, very locally, and just reaching out to them saying, I have an idea, or how can I help? I noticed that the sidewalk hasn't been paved in a decade. Like, what can we do about it? Really, really just jumping in and getting your hands dirty. I would also say another great way to get involved is to think about it not just through the political systems that exist already, but the people power of movements that are happening around you. There's a lot of amazing mutual aid movements that popped up during the pandemic, which is just very natural organizing where you're getting to know your neighbors. There's tenants' rights organizing. There's all types of different ways where you can organize that may not necessarily fit into what we learn in school is the structure of government and organizing.
As someone who wants to get involved, this is really great advice, so thank you. In the survey we're conducting with Celinda Lake, preliminary results find that young women feel it is important that there is inclusive leadership at every level of business and government. Are we doing enough as a country to make that goal a reality? How do we encourage and support women and women of color in politics?
Yeah, this is another toughie. So I would say, I think the simple yes/no answer to are we doing enough? I don't think we are, but I think that we have a lot of incredible people who are really focused on making sure that we do get there. I think that oftentimes when we think about leadership, inclusive leadership, we're really focused, kind of similar to politics, we're focused on the top. We start counting like how many women CEOs, how many women of color CEOs are there, and senators, and just people at the top. I think we should really be focusing on what are we building to make sure that we're even able to get there. And so thinking about a culture shift of how are we encouraging the people around us who are not just the leaders of our organization, but middle management or people who are maybe at the bottom of the work chain to show leadership and to be able to take leadership and to be listened to. I think something that really attracted me to working with Mayor Wu is oftentimes for women of color, we are expected to emulate what we've always seen as a leadership style that is most often something that is just an emulation of men and white men. And so I think that there are so many different ways that we can show leadership. We can be soft-spoken, we can be gentle, we can crouch down and really be eye level when we talk to children. These are things that don't scream leadership in the way that we've been taught, but I think it is leadership. And so really rewriting, what does that mean? What does that look like? I think that will help also women and women of color get elected, because as a culture, we'll start to shift towards what does leadership look like and mean, and how can we instead of kind of saying that we've lost the campaign before we've even launched by saying like these are all the things that make you not a leader, making sure that we are uplifting all different types of what leadership can look like.
That was my last question for you. I want to thank you for your time again. It was a really inspirational interview for me, and I know it is for all of the Wellesley peers as well. So thank you again for your time.
Thank you so much for having me, Michelle.
Hello, and thank you for joining day 2 of the Economy She Deserves Summit. My name is Giselle Mota, and I am the president of college government at Wellesley College. It is my pleasure to introduce Representative Sharice Davids. Representative Davids currently serves as United States Representative from Kansas' 3rd Congressional District, which she's held since 2019. An enrolled member of the Ho-Chunk Nation of Wisconsin, Representative Davis is the first openly LGBT Native American ever elected to Congress and the first openly lesbian person to be elected to Congress from Kansas. She's the second Native American to represent Kansas in Congress and one of the first 2 Native American women elected to Congress. In 2018, she became the first Democrat elected to represent a Kansas congressional district in more than a decade. In the House of Representatives, Representative Davids' committee assignments include transportation and infrastructure, small business, House Doing and Policy, and the Joint Economic Committee. As a first-generation college student and a woman raised by a single mother, Representative Davids is especially focused on supporting families and caregivers, strengthening public schools, and making higher education affordable, and making healthcare more affordable and accessible for everyone.
Hi, I'm Representative Sharice Davids, and I have the honor of representing the Kansas 3rd District in Congress. Thank you to Wellesley College, Spelman College, and to the Global Institute for Women's Leadership for convening today's summit and for inviting me to share a few words. Entrepreneurship has long held a special place in my heart. The area that I get to represent is a hotbed of entrepreneurial activity. In fact, some folks call it the Silicon Prairie. It's catching on, just you wait. And with my position as the chair of the House Small Business Committee, the subcommittee on economic growth, tax, and capital access, I spend a lot of time thinking about how we can ensure that every entrepreneur is supported. This Congress, I introduced a bipartisan bill that would boost women's business owners through the Women's Business Center program. This program was created 30 years ago and was created to bridge opportunity gaps and promote equity. Many WBCs provide multilingual services, evening and weekend hours, and also childcare. In fact, in 2020, the WBC program increased its outreach by 22%. Think about that. During a pandemic, when women were losing their jobs at a disproportionate rate, the WBC program stepped up its outreach. In that year, WBCs counseled and trained more than 82,000 entrepreneurs. They helped start and sustain more than 30,000 small businesses. And that's a really solid record of success. In fact, I've seen it in action in the Kansas City WBC, where they served over 800 clients. I got to meet with some of the women who span diverse industries, from retail to tech to coaching, and they shared how critical the programs at WBC were. They cited things like flexible hours, engagement with the community, and then other unique attributes to bring diverse voices to the table. And I have to say that with more diversity and a more inclusive set of folks at the table, we are going to see better policy. And that's critically important. You know, I'm really glad that you all are convening the summit like you are today, so that we can look at these processes, so we can be more inclusive, so that we can have discussions that are going to address some of the real issues that folks are facing. And I'm very much looking forward to the outcomes of your discussions. Thank you again for inviting me to speak, and I hope to see you all in person soon.
Hello, and welcome to our panel on creating workplaces that work for women. I'm Francesca Donner. I'm an executive editor at Quartz Media. Can you believe we're having this conversation in 2022? I really wish we were not. Women are breadwinners. Women are degree earners. Women are tremendous assets to companies, as if you really need me to point that out. But it's still a surprise when it comes to women in CEO positions. They're still a minority in boardrooms. And workplaces are still very much not designed for women to succeed. To be sure, there has been progress, but the progress is nowhere near where it should be. The battle still feels uphill. So today, we're going to talk about that battle, the things we have done so far, and the things we can do to make sure that we're not having the same conversation in 2023. I'd like to start by introducing our fantastic panelists. Firstly, I have Judy Zamini. She is the founder and executive chairman of the Bikani Group. We also have Lisa Abraham. She's an associate economist at the Rand Corporation. And finally, last but not least, we have Mia Menz. She is the Global Chief Diversity, Equity and Inclusion Officer at Sodexo. She is also CEO of Impact Ventures, also for Sodexo. Hello, everyone. Aren't you glad to be having this conversation today? Mia, I'd like to begin with you. We talk a lot about DE&I, and I think a lot of lip service is paid to it. You have been in a line function for most of your career, most recently with responsibility, if I'm not wrong, for 150,000 employees as Sodexo's CAO for North America. When you finally accepted the job of head of DE&I at Sodexo, you took on a role that is very clearly not that. I'd like to ask you, how do we center DE&I in importance at a company?
First, thank you to Wellesley for convening what I think is a really important conversation. And Francesca, I'm with you. I'm tired of having it, but I suspect we'll be having it next year and the year after that and the year after that, unless something disruptive really happens in both society and our economy. And I perceive that in this particular moment, that we actually are regressing, and there's lots of evidence to suggest that. I also want to say thank you to my fellow panelists. I'm sure that collectively we will be provocative and give the audience something to contemplate. Yes, I have been in this job for the last 9 months, and when we had a pre-conversation, I shared with you very honestly that it's a role that I rejected. I have been in line operating P&L functions for most of my career, and I fundamentally believe that if businesses really want to move the needle on diversity, equity, and inclusion, it has to happen in the business, and it has to happen through business leaders. And so my first instinct was I was going to be pigeonholed as some sort of academic thought partner, and while that's important, it is more critical that you have people that understand the business levers, because for DE&I to be vetted, yes, it needs to start at the very top, but it needs to be deeply institutionalized in company processes, practices, strategy, go-to-market, client value proposition. And it is hard to do that sitting in a siloed HR function. And so the one criteria that I had for this role was that it report to the CEO. Actually, I'd like two. And the second is I keep one foot in an operating role to keep me connected to the business. And that has been the ideal formula. I felt like I had cover, and I felt that I had the levers. That has changed in the last few months. I mentioned that our CEO left. I'm now in the HR function. And I do really believe it's fundamentally more difficult when this role is associated exclusively with HR practices. It is, in my mind, the epitome of cultural transformation and a key driver and differentiator in business growth. And companies who treat it that way are the ones who will ultimately be successful.
Thanks for that. I'd like to push you just a little bit on one part of this, and I'm really curious because we talked about it a little bit before, but do you think it's possible for a DE&I role or person to be successful without white or male or white and male sponsorship or allyship?
Unequivocally, no. You cannot be successful if you don't have that that leadership that comes from allies. I knew that I needed a white male CEO to give me cover, because anytime I talk about this issue, it is perceived to be personal. That I am passionate because of my own lived experience, and not operating in a way that's objective and good for the collective. And particularly in a moment where this topic has become so polarizing, so controversial, if you don't have white leaders who own the power structure, driving the change, calling for change, you cannot be successful. And it is not a coincidence that most of the people that do this work are women or people of color. We cannot do this, uplift this topic independently and discreetly in a silo.
Okay, we're going to come back to some of those issues because I'm not done with you at all on this. But let's move it on. I wanted to take a little bit more of a global perspective here. Judy, you're based in South Africa, where one might argue that the numbers of women in leadership positions are not that bad. That is, until you start peeling back the layers. So I'd love to hear from you. Who is doing well and who is being left behind?
Firstly, thanks very much for that introduction and inviting me as one of the panelists. You know, if you look at government, they're doing much better than the private sector, than academia, where I'm also involved. But even within government, when you look at positions that have clout, we haven't had a president who's a woman. We haven't had a finance minister who's a woman. If you look at the financial cluster within government, it's men. And we also have our own history of apartheid. So in America, you talk about minorities, and in South Africa, the minority is the majority. What do I mean by that? The majority of people are African people, which form 85% of the population, but they are in the minority when it comes to leadership. And it doesn't matter where. And when you then peel that color and put gender into it, and put sexual orientation, disability, the list goes on, social class, then you realize just how disadvantaged the African woman is. So when you look at women representation without looking at the race, you think we're doing okay. It could be up to 30 to 40%. But when you then look at these women, and in this country, we categorize people according to race, African, Indian, mixed race, which is called colored, Asian, and white. And if you look at the demographics of the country, African women are the biggest demographic. But when it comes to leadership in all sectors, they are the smallest. So it is quite a complex challenge and quite a sensitive one. You know, I can relate to what Mia is saying, because when you talk race, people are still very sensitive. It's like you discriminating against a group. And yet, unless we call it what it is, we are not going to be able to address it. So I always talk about an intersectional lens when you look at the challenges that the different groups within the country face, because solving for one aspect always disadvantages, especially African women. Because when you solve for race, which is what we've been quite good at, or at least trying, then the African man benefits. When you solve for gender, it's the white woman who benefits. And then we just go down the bottom of the value chain, and it cannot be. We don't have forever. If it is to be addressed, we need an intersectional lens that identifies all social identities of disadvantage.
Yeah, those are really, really important points. And I'm going to bring this now to you, Lisa. I wonder if, I hope you won't be mad at me for this gigantic question, which is actually impossible to answer, but I wonder if we can sort of take a step back for a moment and if you might talk a little bit about what a truly inclusive and equitable economy might look like?
That's a great question and a big one. So I'll try to take that apart. So first, just want to say to my fellow panelists, it's a pleasure to be here today and to join you in talking about these important issues. An inclusive economy, an equitable economy is one that starts by recognizing the value that women bring. And, you know, all types of groups, we're talking about race, underrepresented groups, minorities. There has to be a fundamental awareness that everyone benefits when talent, right, skills are matched appropriately to the best positions out there for the individual. And so that's kind of the core, right? And that feeds into all these discussions that we have about discrimination in hiring, discrimination in recruiting, that first filter of the pipeline. The second piece of this, right, is actually ensuring that institutions and employers do their part to make sure that everyone can succeed. And that starts with an awareness of the needs of workers. And I think this is something that in the pandemic, we really got a very close look at, right? The childcare, the caregiving, all these issues that came to the fore where work and home really melded together. And so it's, I think, brought a heightened awareness of the need for flexibility. And when I say flexibility, I don't just mean sort of lip service where employers are going out there and saying, yes, you can do this, yes, you can do that, but actually commitment, right? Where employers don't penalize their workers for taking that time to drop their kid off, right? To make dinner for their family. And that, you know, that also gets back to gender norms that we see within the household. There is a really strong precedent here for women taking on the lion's share of work in the household. And so it's sort of all of these different pieces, employers, in the family, gender norms, and then finally, a big aspect of this is government policy. The U.S. is, you know, lags on a lot of these issues, but particularly childcare, right? We know that there are certain penalties that occur when you have a child as a woman. And so thinking about the structural and institutional systems that need to change from a policy perspective is going to be key to making sure that women are able to, you know, succeed in the future.
Totally. And there's also unpaid labor, my favorite topic, because if you're changing the diapers, you surely can't be on a Zoom at the same time, or you can, but it's challenging. I'd like to stick with you for a moment because Lisa, because I want to bring it back into the workplace again. And, you know, you and I talked a little bit about how employers can really do the right thing for their staff by offering all sorts of things that will make people's lives better and frankly make their staff better workers. And, you know, we've talked about things like flexibility and paid leave, but sometimes these perks, and I hope you can see I'm putting it in quotes, perks, can make matters worse. Can you explain that for us?
Exactly. So broadly, we see that, you know, jobs that actually afford true flexibility are really good in terms of making sure that both women and men have equal opportunities. So pharmacists is a classic example in the research in terms of, you know, pharmacists being able to sort of trade off very easily in terms of tasks and assignments and roles. Whereas if you work at a high-powered law firm, right, and you're actually asked to, you know, pull those late nights, work nonstop, you don't have that kind of flexibility. And so when we talk about flexibility, there's an additional layer here of not just providing it, not just, you know, saying to your female employees, you can take, you know, X number of months of maternity leave, but actually setting a norm. And this gets back to what Mia was saying, a true cultural change within the firm that makes it such that when I, as a female, take off the full amount of time for my maternity leave, I am not then stereotyped as a less productive worker, right? I am not, I don't send a signal that I am less productive. And there's actually research on this that shows that individuals who take off longer leave periods are discriminated against. And, you know, purely from the signaling perspective, it's not that, you know, they really lose that much in human capital. It's that their employers look at the individuals who take more time off and they stereotype them, just as they stereotype women for lots of other things. And so in order to actually create change, Francesca, I think this is what you're getting at, it has to really be a true commitment where the norms, the values, the culture changes. And again, that starts with leadership, right, at the top, setting that change.
Right. It's so frustrating. I'm sort of like, okay, here's some flexibility, but don't you dare use it, or you're going to look like this or that kind of person. And actually, I'd like to jump to you now, Judy, because I want to sort of think about what happens in the career a little bit later on. And you and I talked a little bit about how there are such solid efforts made to sort of correct for an imbalance and an inequity at the start of the career journey, perhaps around hiring and things like that. But it seems to taper off later on the career path. And I wonder what ideas you have of what companies and individuals might do to keep up the momentum.
Actually, that's very interesting, Francesca, because I was reading one research from McKinsey in partnership with Leanin.org, where they looked at the training for entry-level hiring of the employees that conduct that job. But when it comes to promotion, when it comes to performance review, there is no training for bias by the employees that do that. So, and when you look at, they actually looked at so many companies, I think about 420 companies, and what becomes very clear is that at entry level, you actually almost getting there in terms of getting women across different identities. But when it comes to all the managerial levels up to the C-suite, it changes, especially when it comes to women of color, which actually talks to the neglect of training for bias against women, conscious and unconscious. But also when you look at how we appraise leaders and how we incentivize them linked to that performance review, it doesn't factor, in most companies at least, it doesn't factor DEI. You know, the promotion of especially people of color or women of color within your performance appraisal. So I think those practices that need to be consistent, that needs to be trained for, and that needs to be monitored and rewarded is not happening. And I remember you said, why should we reward people for doing the right thing? But that's what we do. We know we have share incentives for delivering on the bottom line. And guess what? If we get representation across the board, there'll be better ideas, better innovation, and the bottom line will increase. So reward it in terms of monetary value, amongst other things.
Right. So in an effort to get the results that we want, we have to do what it takes. And that might be pulling certain levers or giving people rewards for things that feel very obvious to us, but maybe not to them. Those are really, really great points. I'd like to come back to you, Mia. I want to talk for a minute about gender at Sodexo. When it comes to gender parity at your company, it's arguably been quite a success story. I wonder, which by the way, it's nice to talk about something positive here. So I wonder if you might take a minute or so to tell us a little bit about how the gender picture has changed over the years at Sodexo, where you came from and what it sort of looks like now. And let's talk, if there is one, about what the magic sauce is and where it goes next. And if we can sort of pull out some learnings or thoughts or ideas that other companies might be able to replicate. That would be really interesting.
Yes, I'd be happy to share. And I'm going to draw on a couple of things that my fellow panelists said. So Judy in particular talked about the pyramid. And I always say what we see in companies is what should be statistically impossible. So at a company like Sodexo, 55% of our base employees, that's hourly frontline, are women. Now, we have made progress because a few years ago, what we'd see at the top of the pyramid was a representation of about 30%, 28 30% of our women. If you go back 8 years ago, we were at 23%. Today, we're at 43%. And so we know that there are things that work very well. One, I talked about this idea of institutionalizing in practices, in HR practices. So we are very rigorous about talent slates. We are conscious about recalibrating the talent management system to take into account things like flex work, parental leave. And I think a lot of this honestly is informed because we are a French company. And I look at my colleagues in Europe and Australia, and I watch them take a year off and come back into their roles, or even sometimes bigger roles. We don't have the infrastructure and the support mechanism in the US for that. And it's a public-private partnership, right? Because in other parts of the world, you see that government actually is investing, companies supplement. In the US, we have very little of either. And so it becomes really a financial calculation, an economic commitment. And that has to be managed through the ecosystem. So for Sodexo to say, we want to increase living wage, we want to provide these kind of benefits, we got to go back to our clients who pay the bills, and we have to have a shared interest in the uplifting of women that is up until now been very difficult to do. We all say we have the ambition, but when it comes back to doing the things that move the needle, it is hard for us to do because it requires trade-offs and firm commitments. So we can, it's called performative, right? We can say the right things, but are we backing it up with action? And I would say for the most part, Sodexo has done that. Pay equity, it is part of the incentive system. We produce reports on a regular basis. Here's where we've fallen short. We have a linear view of diversity, and it is about gender representation. I think the point Judy made about intersectionality is pivotal. We do not do it well. Women of color are lagging, LGBTQ women are lagging, women with disabilities are lagging. So it is so important for us to take a holistic view and to look at intersectionality and to be as intentional about the respective dimensions of diversity. We all have a long way to go, but what I keep saying to my organization, going back to your point about the success, we take this apparatus that we build because we know it works, we have a formula, and you scale it, and you ensure that you're thinking about the other dimensions of DE&I.
So that's really interesting, and it's a really good story to hear, and it sounds like there's still a lot of work to do. And I wonder, perhaps kind of branching into those other areas that you mentioned, and I wonder how you broach that kind of conversation with leadership, perhaps that some leaders might not be quite ready to hear, or they might say, hang on, we really did a good job on that, aren't we done now? Through no fault of their own, because sometimes it can be hard to see things from other people's points of view or whatever. How do you open that door?
The truth is, I can't. As a Black woman, I cannot, with credibility, perceived credibility, push on these other dimensions. The only way to do that is allyship. And so I have had to develop very close relations, again, with white men who we have to put on the journey, because once the light bulb goes on for them and they can be in spaces where they call out things that are unfair and they're advocating for the things that in my mind are values driven, it doesn't happen. It doesn't happen. It's why I made the point about needing cover. When I do sessions with my leadership, I will go find a white male consultant. He can say the things that I cannot say. And it puts us at a massive disadvantage, the women and people of color that need to do this job. But it speaks to the criticality of building this network, this web of influence around you, and leveraging them to drive the change.
Yep, that's a great point. And it's so obvious that this just can't be done alone. And you go right back to that first point that you made in the very beginning about having the male ally somewhere. It's got to be there. That's so critical. Lisa, I'd like to go to you. I want to talk about a couple different issues. And actually right now, I want to build on this idea of gender equity. You had said to me before that it's not a static concept. It's not something that you can just complete and check the box. And I'd like you to explain through your economist lens how you see that as a really dynamic thing? How is gender equity dynamic? Surely if we've gotten to parity 50-50, aren't we done? Can't we move on?
Exactly. I think it's a great point. We definitely need to think of gender equity, this intersectionality that was brought up by my panelists, as an evolving concept, right? It's not a static concept, precisely because the labor market is not static, right? And so you have to ensure that the representation that you're seeing at these bottom rungs, as Mia was saying, of your company, really folds up, right, to the upper layers. And so you can't just, wave your hands one day and say, oh, 50-50, all good, because the next year it might not be that, right? And it might not be that for Black women. It might not be that for, other minorities. And so this gets at, what Mia was mentioning, this constant need for measurement, right? Thoughtful, proactive measurement internally as a company, which I think more and more companies are trying to do. We now have, all this technology that can help us do it, but really looking at the data, looking at the raw data, not just, data that people aggregate in different ways, which we all know can be done, and seriously looking at the pain points and then constantly revisiting this conversation. And I think one example of where this has shown up is actually in these performance evaluations. So, back in the day, people used to do them once a year, and it was very formal and very static check-in. Now more and more we see these HR tech companies that are advertising, and companies have begun to adopt this 360 constant feedback, right? And so I think it really have to move equity conversations into that model where we're sort of constantly analyzing the gaps, the disparities, how they can be closed, and what change needs to happen so that can occur.
Totally. And, we all know this because we've all either experienced it or seen it or read about it, that firms are just notoriously secretive around issues like pay and performance. But the problem there are many problems with secrecy, but one of the problems with secrecy is it makes it really, really hard to make change because you as an individual don't really quite know what you're up against. And I wonder if you have thoughts, Lisa, on what would have to happen for firms to get more comfortable with being more transparent and open.
Right. This is an incredibly thorny issue because it really gets at issues of reputation, which, as we know, is, very core to many, many companies. And so, as a company, I don't want to go out there and say, actually, we had huge discrepancies, which could then open us up for a potential lawsuit, right? So I think it has to start with a recognition that, listen, none of us are perfect, right? No company is perfect. We're all on this journey together. And so the more open and transparent and thoughtful we can be about that, in a way that preserves reputation, but shows that, there are gaps and we're working to change those gaps, I think it has to move in that direction. It has to move away from sort of the secrecy, the lack of transparency that makes it difficult as an employee to know, how you're doing and what types of changes you should actually be seeking out. And this also gets at sort of leadership and culture starting from the top, right? So this is an area where I think CEOs, the leaders can really start to hopefully make change.
Judy, what would you say to that? How can we move beyond this secret state?
It's a very difficult one. I was thinking as Lisa was sharing her ideas, but I almost think we need trailblazers, those that are doing okay, to be the ones that set the scene and then be rewarded, be recognized, because I find that recognition is very important and people respond positively to recognition as opposed to penalizing them. And if I just look at the he for she movement as an example, it talks more to the point you raised earlier on in terms of having men as allies, but it also talks to identifying or welcoming 10 companies or institutions from different sectors. So it's almost like identifying different sectors like they did for he for she, like for academia, for business, and so forth, and identify companies within those sectors that are almost there, but already have transparency as one of their value system, because you start with 10 and then it grows from that when people get recognition from their peers. So I do think it has to start in that way, identifying those that are doing well. Sodexo, I can imagine in the food sector, can be one of those. And in academia, we could choose, I'm actually not sure, I'm part of one academic institution, but globally, it would be quite interesting to choose one that is seen to be progressive in all elements, especially when it comes to the academic leaders within the institution. So I do think it has to start there with a positive spin.
Yeah, that's such a great point. You're also the great giver out of prizes and rewards for people, but that's okay. I think there's such a really good point. So I'm going to conclude now with a lightning question that none of you are going to like. I'm sorry, and it may be a little bit more of a reflection on whether you're sort of a glass half full or glass half empty person. But it's a really quick question, and it hopefully doesn't need too long an answer because we're really at time. Okay, so here goes. Let's imagine that we're having this conversation a year from now. Have things gotten better, worse, or stayed the same? Who wants to go first? How about Mia?
Yes, things will get better because we are at a low point given COVID, and there is so much focus and emphasis, and I would say stakeholder accountability from investors, shareholders, board members, and leaders in concert to drive the change. So burning platform, we will see improvement.
All right, Lisa, are you ready?
I would say cautiously optimistic. I think the pandemic was a real moment of awakening for employers, workers, and government. And I'm really hopeful government can lead on this with some policy changes, as well as employers and workers understanding how their lives need to change.
Okay, and last word to Judy.
A definite yes. A definite yes. We've reached the lowest point with the regression that came with COVID, which affected women more, especially women of color. So it can only get better. What I like, we're talking about it more than we did in the past. I think there is more frankness, and the more we get that frankness, the better it's going to be. And I think we do need to ensure that we have men as allies, because they are in power, and you need people that sponsor you, that are in power, talking to people that look like them, sound like them. And if we do that well, I think we'll get there. Not tomorrow, not in 10 years' time, but we'll move in the right direction.
Well, I think I need to check in with all of you in a year, 2023, and see how we're doing. Thank you so much for your time, your extraordinary insights. This is a wonderful panel and such an honor to chat with all of you and hear what you had to say. Thank you so much.
Thank you. Thanks very much, colleagues.
Hi, I'm Shirley Leung, and I'm a business columnist at the Boston Globe. I'll be moderating the very last session of this summit. I hope everyone got a lot of yesterday's sessions as well as today's. Thank you for giving up a part of your precious weekend to be with us today. We have a terrific lineup of 5 panelists from around the country, change makers who are shaping policy and crafting laws to make an economy that works for every woman. We want to focus on solutions in this session. We're going to do things a little differently. I'm going to convene a series of mini conversations. We have 5 panelists and then 6, including me. So we're going to bring everyone back for the last half of the panel. I have a few questions, but more importantly, we want to hear from you. This is a live session, so I want you to be part of the conversation too. Ask questions, share your ideas, send them all through the chat function. So first, we're going to hear from Wendy Chun Hoon and Jocelyn Fry. Hopefully, they'll pop up on the screens. Oh, there they go. Hi, Wendy. Hi, Jocelyn. Good to see you again. Wendy.
Hi there.
Hello. So she was appointed by President Biden. She's as the director of the Women's Bureau of the U.S. Department of Labor. The Bureau was created a century ago to help develop policies and standards to safeguard the interests of working women. Jocelyn is president of the National Partnership for Women and Families, an organization that works to improve the lives of women and families by achieving equality for all women. Good morning. Almost a good afternoon, right?
Good morning. Good morning.
So, Wendy, we've heard so much about how the pandemic has set women back in the workforce. At the Bureau, you sit on a lot of data and research. What is the data telling you about where women are in terms of an economic recovery?
Yeah, thanks, Shirley, and good to be with you both today. I feel like we are making our way out of this, but just to underscore, at the height of the pandemic, the unemployment rate for adult women was up to 15.4%. That was the highest ever recorded since the Bureau of Labor Statistics, which sits inside the Department of Labor, began data collection back in 1948. So, just in quick summary, women lost more jobs than men because they take on a greater share of family caregiving, which I know this summit has covered well. And that increased during the pandemic, and it drove work hours down. And also women are overrepresented in the occupations and industries that experience some of the largest job losses, such as restaurants and retails and education. So, even as we are recovering, back in January, just 2 months ago, still 5.2 million women lived in households where kids under the age of 5, like my house, were unable to, attend daycare or another childcare arrangement. Regular. That's still with us. And, Friday was Jobs Day. It's the first Friday of the month is always Jobs Day. It's something we really look forward to at the Department of Labor. Despite really tremendous pace of growth and the gains that we saw in March, there are still 1 million fewer employed adult women than pre-pandemic, whereas men's employment has recovered fully. And some of the things that stand out really are, the care sector is still devastated. I mean, childcare, daycare services is still down 11%. Nursing and residential care still down 12%, loss of 4,000 jobs in March. And really Black women's employment has recovered the least. Their employment rate is still the highest among women, and around twice their white counterpart. So some recovery, but we really have to keep an eye on who is not recovering and really address that.
Mm-hmm. I mean, this is a great segue for Jocelyn. I know you're particularly concerned about the challenges of women of color face in the workplace. I mean, we've just heard these statistics about Black women in particular. What are the policies that will help women of color, particularly Black women?
Thanks, Shirley, for the question. And I will really just pick up where Wendy left off. It's great to be here in conversation with both of you. I think, her point is well taken, that if you look specifically at Black women, they actually are an interesting sort of insight into what happened during the pandemic, because Black women consistently, even pre-pandemic and through the pandemic, have had the highest labor force participation rate, but they also often have the highest unemployment rate. And so those things seem counterintuitive, but in fact, what they tell us is that Black women, by and large, are more likely than other women to trying to go to work. And why that's important is that it's a reminder that the problem that we need to fix is not simply the issue of women leaving. It is true women left, and Wendy absolutely agree with that, her analysis that this is largely because of caregiving needs. But we also have a women's employment problem, right? Like even when women go to work, there are barriers in those jobs that make it hard for them to navigate both their care responsibilities and also remain economically stable. So the solutions are things like focusing, drilling down on improving wages, and in particular, pay disparities. Women, generally speaking, are paid less than men. Women are disproportionately in low-wage jobs. Many of the care sector jobs that Wendy pointed to are historically low-paid jobs. They have often been work done by women of color. That is the history of care work in our nation. And so there is a real need to lift those wages, whether it's raising the minimum wage, whether it's raising the tipped minimum wage, whether it's drilling down on pay disparities among women, Black women, Latinas, AAPI women, subpopulations of AAPI women, Native women, by and large, earn less than their white counterparts. Those sorts of interventions are really critical, but we also need to actually improve the quality of jobs that many women of color are in. That means, making sure they have access to the same benefits like paid leave, paid sick days, that they have other supports like affordable, high quality childcare, so that when their kids, that they know that their kids are in safe places. Those things are not peripheral. They're actually essential for women to be able to go to work and function while also meeting their needs. So I think we start there in terms of, policy solutions. In addition to, the last thing I will say is investing in some of those jobs where we know women of color disproportionately work, like home care jobs, improving those jobs, improving the payment levels for those jobs, making sure that they are valued commensurate with the importance that they play, essential role that they play in our communities. I think that's where we start, as being essential to how our economy functions, as opposed to something that we do as an afterthought.
Mm-hmm. Mm-hmm. Wendy, one of the things the Bureau looks at is occupational segregation. I actually never heard of this term until you mentioned it to me in our prep session, and so which explains why we have a persistent gender wage gap and pay disparity. And so, building on what Jocelyn says, has been talking about, how do we create pathways for women, especially women of color, so they're not stuck in low wage, dead end jobs?
Yeah, this is how well Jocelyn and I work together. I'm picking right up where she left off with this. Let me unpack occupational segregation a little bit. It's really what Jocelyn was saying. It's that, women and particularly women of color are really concentrated into what have become more female dominated, or have long been more female dominated jobs, which are, as Jocelyn was saying, really the devalued and undervalued jobs in the economy as compared to the more male dominated jobs. So this was, this is not a pandemic thing. This is true long before the pandemic, that women have been overrepresented in the occupations and industries that really pay the lowest wages, have the lowest benefits in our economy. And these were the jobs that saw the greatest job losses during the pandemic. So it's a double whammy. And what I would say is, we, in March, which is where we have this awful recognition of what we call Equal Pay Day, really just marking that, 74 days into the new year, we are women on average, full-time, full-year earners, which is not everybody. And I really want to be clear about, there are disparities underneath what I'm about to say, major disparities, but where women's, catch up to the wages paid to men on average from last year. And for this Equal Pay Day and for Women's History Month, the Department of Labor issued a major new report that actually put a figure on what it costs, what occupational segregation costs. In 2019, so this is the year right before the pandemic took hold, what I'm about to tell you is true, that Black women lost an estimated $39.3 billion. That's 1 year, $39 billion. Hispanic women, an estimated $46.7 billion in lower wages compared to white men. That is the year right before the pandemic hit, because of occupational segregation, because of the jobs that we work in and also the jobs we don't work in. So what Women's Bureau has been working on for a while, and I like to reference a grant program that we have called the Women in Apprenticeship and Non-Traditional Occupations. It's called WANTO for short. But what this really is it's a job strategy to help women gain access to the kinds of jobs that we're usually shut out of, right? That we are by far the minority in, and really gain access to strategies like pre-apprenticeship programs, and then apprenticeship programs into things like the skilled trades, and all the jobs, as we're looking at the bipartisan infrastructure law and how that is going to play out over the next decade, and the $1.2 trillion of investment in these kinds of jobs in transportation, in construction, et cetera, that are going to rebuild the country. Women need access. Women of color need access to these kinds of jobs. And so, the WANTO program is a great example of how we're trying to affect that. And that really has an opportunity to be scaled at this moment, and really thinking about all the way from the federal government as that money moves its way down into states. How are states meeting that moment? How are we all decision makers in how that money and those investments really will help us achieve greater gender and racial equity?
Mm-hmm. So a lot of retraining and grants and, at the federal level and state level. So that's really important. I want to bring up one more other thought before we move on to our next group of panelists. This has been terrific. One of the things that came up at the some of the earlier sessions was about how women are in jobs where or women tend to quit, they're quitting jobs. Maybe there's a caregiving situation, so they have to suddenly quit their job, and then they come back, and that leads to some of the disparity. I mean, how do we deal with that so women aren't penalized, for basically doing the, when something goes wrong, like during the pandemic, when there's no childcare, they're the ones that quit their jobs and have to save the family, and so how do we create a system where women aren't penalized for doing the right thing?
Well, I mean, I'm happy to start. I'm sure we both have thoughts on that. I think that there are a couple of things, and I think it's first we should start with the fact that, the pandemic was, suffice to say, an extraordinary, unprecedented event. So there are some things that happened during the pandemic that hopefully would never happen normally. That being said, what it revealed was a lack of sort of basic policies that we really needed to have in place. So, to the extent that what a woman might encounter is a need to stay at home because a parent is ill, they contracted COVID, or their school was out for a week or something like that, like some short-term need for leave. Many women did not have access to those sorts of protections. So that's why people talk about paid sick leave and paid family leave. Just the ability to deal with the caregiving challenges that come up. And the benefit of having that policy in place, those policies in place, is that folks can leave the workforce and come back often without interrupting their jobs or interrupting their careers and their wages and so forth. And there certainly is data that shows that things like paid family leave do help with labor force participation, women's labor force participation, which can help in terms of their wages, just to minimize those disruptions. needs. On top of that, when there are outsized circumstances where a departure from the workforce can't be helped, I think the other layer here that is important to raise is what I would call sort of more of the equity analysis and the anti-discrimination protections that just ought to be available to make sure that women are not treated unfairly simply because they have caregiving needs. We often forget that things like the Family and Medical Leave Act, have their roots in anti-discrimination. The reason that law was put in place was not simply to allow people to deal with care needs. It was because women were often discriminated against because they had kids, because they had families, because they were more likely to step away from the workforce. And there was an incentive for employers simply to say, well, I don't want to have women. So, the law was put in place to make sure that there was sort of a gender neutral way to do care. And that equity purpose is still relevant today. So it requires us to ensure enforcement, to make sure, if you fire somebody and say, I just don't want to have women because they're more likely to have kids, people should know that's illegal. It is illegal. And we need to make sure that, employers adhere to the law. So enforcement is really important too. And I will say that the administration and the original budget that the president put forward acknowledged that with more money for enforcement, because that must work in tandem with all of these other policies.
Great. Well, thank you, Wendy. Thank you, Jocelyn. We're going to see you in a little bit. So I think you're going to magically disappear. And then our next guest will come. Next group of panelists will be here. We're going to next hear from Congresswoman Sarah Jacobs. Hello, Congresswoman Jacobs. And also, are you joining us from DC or San Diego this morning?
DC.
DC, okay. And then we have Massachusetts Senate President Karen Spilka. We're, probably just down the street from me, right? I'm in Boston. You're probably in Ashland or Boston, right? Hopefully. Anyways, Ashland. Okay. Lovely Ashland, Massachusetts. So Congresswoman Jacobs in the middle here represents California's 53rd congressional district. She took office in January 2021. She represents, among other communities, San Diego. So it's sunny here in Boston, not warm, but just sunny. But we'll take that. Anyways, she took office in January 2021. She's 33 years old and one of the youngest members of Congress. Prior to politics, she was the founder of San Diego for Every Child, a coalition dedicated to ending the experience of child poverty in San Diego County. Welcome to the summit. We have here also a longtime public servant, Senate President Spilka. Hello. I haven't seen you in a while. We got to get together in person past this COVID thing. Anyways, she has been in her role since 2018. She has helped steer the state through the COVID public health crisis by passing legislation that puts patients first. She also has made improving education and access to mental health care some of her top priorities. So I'm going to start with you, Congresswoman Jacobs. It can be hard to keep track of all the various bills related to childcare in Washington. You co-lead on a bill with Massachusetts Senator Elizabeth Warren called the Universal Child Care and Early Learning Act. But it's my understanding the major bill moving through Congress now is the child care plan in the Build Better Act. So I was wondering if you can talk about what excites you the most about what's in that plan and what happens if Build Back Better, stalls.
Yeah, it's a really good question. And I fought really hard to get Build Back Better passed through the House, which we were able to do. Unfortunately, we all know the Senate is a bit of a bigger challenge. And so it is currently stalled there. And there are separate negotiations happening right now on what a potential pared back bill might look like. And so it's hard to know exactly what's going to end up in that bill from those negotiations. But in the House version that we passed, part of what I was really excited about is that we were able to get it so that no family would have to pay more than 7% of their income on childcare. We know that the cost of childcare is one of the biggest costs for families. For my constituents, most families in San Diego, if they have young kids, are paying about 40% of their income on childcare. So getting that down to 7% would be hugely impactful for families. And that I fought really hard to make sure that for that 7% provision that we had the cutoff be at 250% of state median income, so that we weren't leaving out middle class families in high cost areas like San Diego, like Boston, where some of the lower numbers the federal government will often use as cutoffs just really doesn't take into account what the cost of living is really like for families in these places. And so, you know, I was really excited we got that in the House version. We're working really hard to get something that will pass the Senate. It won't be everything that we want, but it will certainly be better than what we have right now. And the way that I think about childcare and what we need to be doing is there's basically 3 different pieces we need to address in our childcare system to make sure that it's actually equitable. So the first, and the piece that I just talked about, was cost, right? We know it costs families too much. Even when families can find childcare they can afford, it often doesn't meet their needs in terms of hours or accessibility. And so we need to make sure we're designing a system that actually is affordable and accessible for families. The second piece is we need to make sure that it's high quality early care and education, because we want all kids to benefit from those investments and get the benefits down their life that we know that early care and education can do. And then thirdly, and as we heard from the last panelists, we need to make sure that those care jobs, the people providing that care, are getting paid good jobs, are getting paid commensurate with the value they add to our society, which, as we saw during the pandemic, is basically the foundation for the rest of our society to be able to function. And most of the people who do that are women and people of color. And so just making sure that those care jobs are good, that we're supporting those often small business owners who are childcare centers, family care centers, family home care, is really, really important to be able to address equity. So making sure we're designing a system that fits all 3 of those issues is really how I think about all the way we need to be working on it from the federal government.
And how are we paying for it?
It's a good question, and there's 2 answers to that. So the first, in the Build Back Better Act, we have it paid for through making sure that corporations and the wealthy pay their fair share and lowering prices on prescription drugs. So there was a 15% corporate minimum tax, and no one earning under $400,000 would see any tax increase. And in fact, the child tax credit was one of the largest tax cuts for middle-class families. But I think there's a larger question, or a larger answer to this question, which is it's about how we think about our budget. So actually investing in early care and education is one of the best things we can do to address the deficit, because for every dollar that we invest in early childhood education, we actually end up getting a return on investment of $6 to the federal government because of the higher earnings over the life cycle of that child's life, and the increased labor force participation. And we actually lose about $1 trillion a year in GDP because of depressed female labor force participation, in part because these parents don't have access to the childcare that meets their needs to enable them to go into the workforce. And so I actually think that the least responsible thing we can do fiscally is leave our childcare system the way that it is. And we know that investments in early care end up paying for themselves, in part because of, again, the life cycle of the child and the increased labor force participation of parents.
Senate President Spilka, tell us about what's going on at the state level in terms of childcare. I know that you've been very passionate about this, and but what can states do as we wait for federal action?
Thank you. First of all, I just want to, my gut response to that is for states to not wait. that is a start. But I want to thank Wellesley College, Spelman College, and the Global Institute for Women's Leadership at King's College London for convening this important seminar and summit. And thank you, Shirley, especially for moderating today, but for really staying on top of issues of equity and fairness at your day job at the Boston Globe. Thank you. Really, we need you to continue doing this. And you're right. I just want to say that both Wendy, Jocelyn, and Congresswoman Jacobs are spot on, and it's music to my ears. And we have a lot of a parallel process going on here in Massachusetts. A year ago, I spoke to the Greater Boston Chamber of Commerce and noted the COVID-19 pandemic has brought the women's labor participation rates to the lowest point since 1988, causing what many have termed the she-cession. Women who work in non-caregiving jobs are increasingly being sandwiched between aging parents and growing children. And subsequently, because they're being squeezed in that sandwich role, they drop out of the workforce in alarming rates to care for those who rely upon them. It still is more, unfortunately, the woman's role. At the same time, too many Black, brown, and low-income women who work in caregiving professions have been crushed by the job losses of the economic downturn, with devastating results for their families and for our communities. So as a result, we're all feeling the squeeze that you mentioned. Massachusetts, unfortunately, has among the most expensive childcare in the nation. At the same time, the need for affordable, accessible childcare is dramatically increasing. By 2030, more than a fifth of Massachusetts residents will be 65 or older. So the need for elder care is also increasing. And this age group are less and less able to afford it. So in a nutshell, we are, I believe, in the midst of a caregiving crisis, and we need to think outside the box. We cannot outsource these jobs. The people performing these jobs need to have day-to-day contact with those that they are caring for. That's why I am proposing that we steward federal and state dollars to create a system of intergenerational care that provides a way to support, connect, and integrate community-based care across all ages, with the goal of making intergenerational care accessible and affordable to all. At the same time, supporting the workforce that make it possible. In 2015, I created what we term here in Massachusetts the Family Resource Centers, or FRCs. It was a part of an overhaul, and Shirley, you may remember, we got rid of the old CHIN system of the status offenses and created the Family Resource Centers as the front door for families to go to turn for help, turn to assistance. They could access basic services such as behavioral and mental health or housing support. They have proven to be incredibly successful, but they currently only support families with children under the age of 18. I would really like to see us expand these family resource centers, and I've consistently, systematically put millions of more in the budget when I was Ways and Means Chair and I was Senate President, to expand them across the state and build upon the successful Family Resource Center model to create intergenerational care centers where everyone, no matter what age, can at least access information about childcare, elder care, and before and after school programs, as well as services for residents at all stages of life and all levels of ability, including mental and behavioral health support. I don't know exactly what these intergenerational care centers will ultimately look like, but I've taken the opportunity to propose our Massachusetts moonshot, so to speak, and do some long-term planning for intergenerational care. In the meantime, to go back directly to your question, there are steps that we can take now to lay the foundation for the future vision of caregiving, starting with shining a bright light on the needs of our caregiving workforce. Even though they are needed now more than ever, care workers continue to be undervalued and underpaid. So by centering care providers who are frequently Black, brown, and low-income women in our economic recovery efforts, I believe we can support an equitable recovery, better quality caregiving, and much stronger, much more connected and healthier community overall. In the coming months, Massachusetts Senate, I am pushing forward, will take up legislation addressing early education and care. In the last year, we created and established an Early Education and Care Economic Review Commission to review childcare funding and make recommendations on policy changes and expand access. The commission, thankfully, just recently released a report shedding light on how we can act to make early education more accessible for all, while also, so it's not only accessible for the families and for our children, but also supporting the providers who do this job, that run these places, and the workers on all levels. Now that we are armed with the data we need in the Senate, I believe that we need to take bold action. Again, it would be great to have the Congress take action and send some funding our way, but I don't believe that we can wait. I've also met with Senator Warren, had her out to some childcare centers in Framingham a few months ago, and spoken at great length with her about this issue. And I agree, childcare is part of our infrastructure that we need to continue to support, just like we do our roads, our bridges, and other areas of our education system. And here in Massachusetts, our family resource centers could be used as infrastructure to serve families at every level. And you will see, Shirley, in the budget, once again, a big increase for family resource centers. I think that, we in the legislature last year, before we did a child care tax credit way to help families, we do that again this year. I believe that intergenerational care is about expanding that definition of infrastructure to include caregiving at every level. It takes everyone in our society, government, advocates, workers, the private sector, and our nonprofits. We can't let them off the hook either to make intergenerational care a reality. But we've never accomplished anything great without thinking big, and I really believe that we can do it. Thanks.
Thank you, Senate President Spilka. Who's your internet provider? We need to call them out. Anyways, Congresswoman Jacobs, one of the things Jocelyn and I know Wendy can talk a lot about paid leave, because in her prior job she did a lot of paid family leave lobbying and got a lot done across states. But talk about, where are we in paid family leave in Washington?
Yeah, it's a great question. And again, we were able to get it in the House passed version of the Build Back Better Act. And unfortunately, again, that stalled in the Senate. But I'm feeling optimistic that we'll be able to get something done on paid family leave in Congress, in part because we know that there are some Republicans who are interested in working on it. But also because we've been able to get things done on paid family leave when it comes to certain parts of the workforce through very creative means. So I'm on the Armed Services Committee, and actually before I got to Congress, we were able to get paid family leave for federal workers through the National Defense Authorization Act, in part as a sort of thing Democrats got in order to agree to the Republicans' desire to build the Space Force. So I think that there are some creative sort of negotiations we can do around getting this done. But I'll also say a big part of getting childcare, of getting paid family leave done, is actually making sure that people understand what caregiving is actually like right now. And so I as a millennial, I hear everyone talk about the sandwich generation. My peers and I are living the sandwich generation. But I often will talk to some of my colleagues on both sides of the aisle who don't realize that we don't just have an aunt down the street, or we don't have a partner who's at home full time watching our kids and taking care of our caregiving. And I think it's important that we really talk about what raising a child what taking care of family members is really like. And I think it's also important that while we know right now so much of that burden falls on women, that actually we talk about it in a way where we stop normalizing the fact that it is only women who are the ones doing this work, and that it should be both partners in a partnership who are taking on the caregiving roles. And that will go a long way in making sure that we are building a more equitable society, one household at a time.
Mm-hmm. President Spilka, you got paid family leave done in Massachusetts a few years ago. How is that? Tell me about is there anything would you do differently? I mean, is it 12? How many weeks would you make it longer? Is there anything that you've learned now that's been implemented for a few years?
Yeah, I would make it as long as possible. And that was part of my push. And I was able to push it to be long. But I originally, the first bill I filed my first paid family and medical leave bill in 2006. People thought I was crazy then. And I kept pushing it. And then over time, like the mushroom of support, it grew and grew. And then the Raise Up Coalition, there were a couple of ballot questions, credible coalition of labor, business, and advocacy organizations. If you remember in the Grand Bargain, that was part of it. We created a permanent sales tax holiday. These were the trades that we got, a permanent sales tax holiday. We raised the minimum wage to $15 and created a paid family and medical leave. It was something, I figured it was hard at first because our structure that we didn't have like some of the other states that had already implemented. We did not have an automatic structure to put it into, so we had to create generous paid family and medical leave bill in the country. And I think we succeeded at the time, resulting in paid family and medical leave law that calls for up to 12 weeks of job-protected paid leave to care for seriously ill or injured family member, or care for a new child, or to meet family needs arising from family members' active duty military service. At the same time, there's authorizes up to 20 weeks of job-protected paid leave to recover from a worker's own serious illness or injury, or care for a seriously ill or injured service member. It started January 1st, 2021 for workers seeking time off to bond with a new child, or take care of a sick or injured service member, or tend to their own serious personal health issue. In July 2021, benefits were made available for workers to care for a family member with serious health issues. I've long said that no one should be forced to choose between a paycheck and caring for a child or a sick family member. And I think with this pandemic, you all would agree that this is even more serious and more important than ever. When I was implementing it recently in the Senate, Massachusetts Senate, we had a paid family and medical leave plan. I could have chosen the state, which was a little bit smaller, or keeping ours, which instead I combined both of them and built and made it probably the most generous public sector paid family and medical leave plan in the state.
Wow. Well, thank you very much, Senate President Spilka. Thank you, Congresswoman Jacobs. We will, you guys will come off briefly and then come back, and we're going to welcome our last panelists before we all come back together. Heather Long from the Washington Post. She covers, she writes about the economy. She's an editorial writer, and you're also a proud alumni of Wellesley College. And so you probably have heard this joke, right? That, up here in Boston, we call the Washington Post Globe South. because the Post,
I know many of your former colleagues. Yes,
a lot of Boston Globe reporters and editors there. So we call it, that's our little joke, Globe South. Anyways, thank you for joining us this morning. or now afternoon. I have a few questions, and I just want to remind people to keep your questions coming from via the chat function. We have some really good questions, so we're going to get to them right after we talk to Heather and I talk a little bit. So let's talk about the private sector and employers. Are they doing enough to help women get back on track after the pandemic? What are you seeing?
Yeah, I'm so glad you asked that, Shirley. Obviously, these past 2 days, there's been so much discussion about the need for government to do paid family and sick leave, and to do paid parental leave and affordable childcare, and to raise the minimum wage, which has been stuck at $7.25 since 2009. But you're right, there is nothing holding back companies from doing all of that right now, today. They don't have to wait for the government to set a mandate. And there was some encouraging movement in these areas during the pandemic. There was a big expansion for paid sick leave, partly because there was a temporary mandate from Congress to do it, and partly because companies realized that having workers coming to the factory, coming to the office with COVID was hugely dangerous and immorally wrong. And so they did implement sick leave, at least for most of the past 2 years. The downside is we're starting to see some of that roll back, particularly for hourly workers, for people who don't have as much job protection. We sort of saw the same wake-up call for childcare. There were finally not just moms saying, I can't do this, but dads, were also struggling and saying they had never felt this strain before. And they were turning to their companies and saying, what can we do? And you saw everything from some businesses constructing childcare facilities on their premises. Others were designating a staff member to help families navigate what facilities were open or what options there would be, virtual or in person, to help out with the childcare situation. Again, the big question is how much of that momentum remains and sticks around. The last thing that we overwhelmingly hear from workers is this buzzword flexibility. I've heard it a lot today in different sessions. And a lot of us immediately think, oh, that means work from home and the ability to do that. And sure, that's great. But the reality is only at the moment, 10% of the workforce is working at all from home. So this is not something that's affecting the bulk of the workers. What I was encouraged to see from the flexibility standpoint, I remember talking to some folks earlier this year who work at an appliance factory in Ohio, and they said to me that for the first time ever, normally in a manufacturing factory, they run 3 8-hour shifts. And they said for the first time ever, our company is offering a part-time shift, or had created what they call the parental shift, where people could work from 8 a.m. to 2 p.m. So be able to leave early enough to go pick up the kids from school. And so, again, these types of things were sort of unthinkable before the pandemic, and they're so basic, and they don't require a lot of give from companies. The last one I personally want to throw out, Shirley, I know you've thought about a lot about this too. We have also seen, and I think I know I changed my own views on this, a need for companies to set clear targets. I hate to use the word quota, but we can talk about diversity and the need for more women and people of color in positions of leadership all day long. And we just aren't seeing any movement except at companies that actually say, we want to make 50-50 management track men and women, or we want to have a certain target, and that we're going to hold people accountable. If we don't hit that target, then the managers who are in charge of that division, are not going to get the pay raises or get the good reviews. And, it doesn't happen overnight, but a lot of companies have said, we want to do this by 2025 or by 2030, so it gives them time to make this happen. But I personally, 15 years ago, I probably would have been against something like that. And it's really opened my eyes, having been in the workforce now for almost 2 decades, to see that progress just stalled. The last thing, if I could just throw one more thing out there, as you noted, I cover the economy. This is the time to ask businesses to make these changes. This is the best, most worker leverage that we have seen in this economy, probably in everyone's lifetime who's watching this or participating in this panel. At the moment, there's 11 million job openings and 6 million unemployed people in the United States. It's almost 2 job openings for every unemployed person. Companies want workers, they need workers, they are desperately giving raises to try to hold on to workers. We've just seen the first unionization in an Amazon warehouse in the past few hours. We've seen it at multiple Starbucks. And so, I'll give you a personal example. I had a couple of media companies reach out to me in the past year to say, Feeler, would I go work for them? And one of them, when they called, I said, I really love your organization. I would love to work for you, but you offer the worst parental leave of any major media company. I said that to the recruiter.
Good for you.
That to me shows that your values are not what I think your values should be, and what you're telling your viewers that the values should be. And, that recruiter thanked me, and they took that feedback back. And, I have noticed in the past few months that company is engaged in negotiations. I'm not going to say it was just me, but these are the types of small moves we can all make. And I would just note, I'm a proud Wellesley alum, but right now there's a discussion at Wellesley about non-tenure track faculty who are mainly women, who are mainly people of color, and they feel at the moment that they're not being paid adequately or treated well. So at every organization, we can make positive pushes and changes.
Great. I love that. So I have one last question for you before we bring everybody back. I'm trying to keep on schedule here, but you also looked at what other countries are doing to help women in the workforce. Tell us what's going on in Japan.
Yeah, I'm glad you asked that. So I came at this from a US perspective at first, because the United States used to be #1 in the world for women's labor force participation. We were sort of tied with Sweden. We would trade off with Sweden in the 80s and 90s for who was #1. And in the past 2 decades, the United States is now 23rd in terms of women working outside the home. And you're right, I started looking around who are these other countries that have surged ahead of us? And one of the prime examples is Japan. Japan was for many years not known as a pretty terrible workplace for women. And in 2013, their prime minister at the time made this push for womenomics. And, it's not been perfect. I want to be upfront. There's a lot of Wellesley alums in Japan and Spelman alums who would tell you straight up that there's still a lot of issues there. But they use this very basic framework, which we have been talking about at this summit the past 2 days. They mandated 14 weeks of paid parental leave for both moms and dads. They changed their tax structure to make it incentivize both partners to work. And they greatly expanded government-funded childcare centers. And so you put all of this together, and they really encourage men to take parental leave. So the burden wasn't just on women. And Japan now has a labor force participation rate among women that is better than the United States, which would have been unthinkable a decade ago.
Great. Well, Heather, stay on. All right, don't leave us. And now we're going to bring everyone else back. We have, I think we have about maybe 10 more minutes. I know this has gone by fast, right? So we have actually some really good questions. So let me get to one of them. This is about caregiving jobs. How do we go about increasing the monetary value we place on caring jobs? I agree they should be compensated commensurate to how important they are, which is very, very important, but I'm not sure how to actually change anything.
So maybe I can jump in and say what we were trying to do in the Build Back Better Act. So basically what we had in the Build Back Better Act was we had for the states, we asked them to each develop a plan that reflected the true cost of providing quality care, which included a living wage for care workers. And that would be the basis with which they got federal dollars and would be the place where they, where we could make sure that they were doing what we wanted in terms of quality and in terms of quality of the jobs that these investments would have created. So that's kind of how we're thinking about it from the federal government level.
And actually, I just want to add that's part of what our Early Education and Care Review Commission did. So we are primed for the Congress to pass the Build Back Better bill, to get the funding to take advantage of some of these things, hopefully, fingers crossed. But part of that is certainly giving more funding to be able to pay the early ed and care workers more funding, higher salaries. That would recruit them more, giving them more salaries, better benefits. As noted, The cost of not investing in this system is way higher than investing. I think this is our future, and these are our children that will be taking our future forward. And we need to ensure that we have a strong caregiving workforce in these centers to make sure that the providers are strong, the workers are strong, and the families and the kids are strong as well. So the funding needs to address all of those areas.
Mm-hmm. Great. I have another question from the audience. How do panelists see the role of working women collectives and trade unions in building an agenda for change? How important is it for the success of creating a women-centered economy for governments and employers to have true partnership with trade unions in creating and implementing policy? Who wants to take that on?
Well, I mean, I'm certainly happy to start. I mean, I think unions are critical. The evidence is clear that union participation helps to raise women's wages, helps to ensure that women have access to better benefits. And I think in some industries, particularly some of the lower wage industries, the collective power of women coming together often is successful in driving change, particularly when there's an enormous power imbalance. So I think that efforts to support union organizing, expanding access to collective, engagement is really critical. And I think investments and efforts to, support worker power is important. And, I think to its credit, the administration has tried to invest in some of those strategies as well. I don't think we should always view these relationships as adversarial. I think that there are ways for employers and unions to work together, for the common good. And so I definitely support the greater access to union organizing.
Jocelyn, if I can add, I've been in several conversations recently where all the women in the room are saying, I'm in an equal pay job because I'm in a union. So that just cuts right to it. But I would also say, Shirley, to the broader question, we know that if we don't take a gender racial budgeting lens, right, and really center who are most marginalized, who are furthest behind, and really create strategies to center that experience and also address that issue. We're not in a winning mode. We're not in a most efficient mode. And so really taking on that kind of innovation that Heather was talking about in this moment and really embracing it by centering women of color in the solutions in this moment, as we are spending on things like infrastructure and hopefully spending on things like care infrastructure.
Absolutely. And just one thing to add on this, since we talked so much about occupational segregation, I think it's important to note that there are many sectors of the economy, many of which are done by women, that are not eligible for the same kinds of labor laws and unionization rules. Domestic home care, care jobs are a big piece of that. And so that's why, in addition to making sure that we're strengthening unions in general, we also need to make sure that all kinds of workers are actually eligible to use the protections of unionization. In California, we recently changed things and now have a child care providers union, and it's been really impactful in helping to make progress on, for instance, wages for care workers.
Mm-hmm. One more question from the audience. I think this is off of something maybe Heather had mentioned. What do you think is responsible for the United States dropping below so many other countries with regards to women's participation in the workforce? Oh, if it's Heather or Wendy, one of you.
Well, I'll start and Wendy can finish us off. But I mean, the obvious one is we're one of only 8 nations in the world that doesn't have paid parental leave, particularly paid maternal leave. I sometimes say that to some of my friends in Europe, and they still can't get their head around the fact that there's zero weeks of paid parental leave in the United States. So that's definitely a big part of what's going on. Same thing with paid sick leave. These are just so obvious around the world. And again, we're creating an economy where people who earn basically are in the white collar jobs who are earning over $80,000 a year have access to these benefits. And then the 70% of the economy that doesn't earn that does not have access to this. And so that's a big part of this, these disparities. So I think too, again, when you go to other parts of the world, there's just a lot, it's a no-brainer that the partner, particularly a male partner, would take some time off as well. Whereas in the United States, we're just finally starting to see some movement of having men really step up and with those child and elder care responsibility.
Yeah, I would only add two things, and it's in reference to what Senate President Spilka and Representative Jacobs were saying earlier, that we know how to design policy like paid leave, like childcare, that get to actual gender equity, right? That is why paid parental, paid family medical is inclusive, because it is every parent, every caregiver who needs these things. And in fact, every one of us who are working and across the country. And the other thing that we all reference constantly, which we need to change, is that other countries have social safety nets and the United States has women.
All right, so last question for me, and we'll round out this panel. So people watching from home, maybe they're in their pajamas or maybe they're in their dorms or on the couch. If there's one thing any of us sitting at home can do to create an economy that works for all women, what would it be? What would your call to action be? Jocelyn, why don't we go? Jocelyn, Wendy, we'll go around the block.
Well, I think what I'd say, at the risk of repeating what we've all talked about, I think I'd tell people to call, whoever their member of Congress is, their senator, and tell them that it is important and essential that they actually make good on, the promises that they like to make when they're running for office, and actually pass policies that will help women in particular care for their families. It is nonsensical that after an unprecedented pandemic that was driven in part by our, abysmal lack of care policies, that the one lesson that we learned out of it, that we need those policies, and yet they have largely failed to move forward the very policy that so many women need. I think not only is it nonsensical, it's a little insulting, truthfully. And I think that people have to make their voices heard and let people know this is not just an afterthought. This actually is essential to how our economy functions. And the only last thing I would say about this, if you look at that Japanese example that Heather was bringing up, one of the reasons you center women in the economy is that it makes your economy stronger. It improves your GDP. There's data to prove it. So this is not just something nice to do. It is actually helping our economy grow, and they should be acting on it yesterday. And I encourage everybody to do that.
I double down on what you said, Jocelyn. Care is not a Democratic issue. It is not a Republican issue. It's an all of us issue. We need it desperately. But the other thing I would say is, in addition to decision makers in Congress, there are a lot of decisions that will be made at the state and local level over the next decade about the investments that Congress has passed, $1.2 trillion to rebuild our infrastructure in the country. And I would like to know that women and women of color are going to be in those jobs. And I think we all would. So raise your voice about that as well.
So
yeah, I would just...
go ahead. I have no idea which way we're going. Heather, why don't you go?
Oh, sorry. Yeah, me neither. Go ahead, Heather.
All right. Yeah, I would just encourage people to speak up. Now is the time in your own organizations as much as you can. Big reason that the Washington Post, where I work now, has 20 weeks of paid parental leave is because a group of people at our company got together and kept pushing the issue, wrote memos, put research. I've also participated with groups that have gone to our managers and done pay studies and said, look, we looked at this data and it doesn't look so great. What's going on here? To ask those questions, to raise those issues constantly, particularly right now when so many people, the great resignation is going on. Companies do not want to lose workers and they are willing to listen.
Senate, sorry, I gotta play Hollywood Squares, right? Okay, Senate President Spilka, and then Congresswoman Jacobs.
Right. I was going to echo the same thing. We need to be looking this at a federal, level, and contacting your federal delegation as well as state. But the businesses, as I said earlier, we can't let the businesses off the hook. This has to be a partnership. But the more pressure that's put on the businesses, the more pressure the businesses will then put on the state and federal delegations as well for assistance and for guidance or some help along the way. So I think that it's really important. And I think it's also really important to get more women elected, whether it be in Congress, on the state level, because we care about these issues. Not saying men don't, but as we all have noted, women are the ones that are sandwiched and squeezed more than men. And we need to keep women in the workforce for themselves, for their families, and for our economy. Women are smart. They bring so much to their jobs. We need to have their brains at whatever job that they're doing for our economic future as well.
So I totally agree with everything everyone else said, and I will take it down to a more personal level because I think each of us are making these calculations for ourselves in our families and in our households, and they feel like individual decisions. And each of those individual decisions, though, add up to this economy that is so unequal. So if you have a nanny, if you have a housekeeper, if you take your kid to a childcare center, if you can, make sure you are paying those people a living wage. Make sure you are giving them benefits. If you and your partner are trying to decide who's going to take time off to make sure the kid gets to the doctor's appointment or your elderly parent is getting taken care of, just take a beat before it's automatically the female partner who's the one who's automatically assumed that they're going to do that. Because while we do need policy change, and I'm working every day to get us there, it's also going to require individual change at each household level to make sure that we are actually building a more equitable society.
All right, this has been a terrific panel. You guys have been amazing. I'm hoping that everybody is inspired listening and watching from home. But thank you, Congresswoman Jacobs. Thank you, Senate President Karen Spilka. I want to call you Madam. Can I call you Madam President?
Sure,
I love that.
Sure. You can call me whatever you want.
Madam President, Heather, Wendy, Jocelyn, thank you so much for your time and your insights. And thank you to Wellesley, Spelman, and King's College. That's a wrap.